introductions, and at 9:30 we have our first presentation. So Andrea, are you there?
Okay. Yes, I am here. So, you ready for the roll?
Yes, please.
Okay, we've got Representative Armstrong.
Which one?
Yes, Debbie Armstrong.
Gail. I'm sorry, Gail.
Yes,
Right.
Gail Armstrong is president.
Okay, thank you. Joanne Ferrari. Greg. Wanda Johnson. Bill O'Neill.
Sorry,
Cliff Turtle.
I'm trying to help Representative Ferrari get in.
Oh, okay. And then Deborah Armstrong is here, and Senator Gerald Ortiz-Pino is here.
So if Ferrari gets in, we have what, 4?
I'm in.
Right.
Great.
Oh, okay, good. All right.
Thank you, Sabina.
All right. Well, good morning, everyone. Let's have introductions. If you don't mind starting, I'll just go down the list. I'll mention your name, unmute yourself, and introduce yourself. Let's start with you, Senator Padilla.
Good morning, Mr. Chairman. I don't have a virtual background or any sort of background going on. Just I want to be here with you guys, and I'm so happy to be here. I do represent the Southwest Quadrant of Bernalillo County, about 80% or so of it. I'm one of your neighboring senators, Mr. Chairman, and thank you all very much for such a colorful start to this call.
Thank you, Senator. I see you have your hand up for a question already. Is that inadvertent, or do you have a question?
No, that is inadvertent. I'll take a look. I don't remember doing that. Thank you for letting me know.
Great. Senator Cedillo Lopez.
Thank you, Mr. Chair. My name is Antoinette Cedillo Lopez, and I'm also your neighboring senator, just east of you in the diversity neighborhoods, southeast and northeast District 16.
Okay, Representative Gail Armstrong.
Good morning. Thank you, Mr. Chair. My name is State Representative Gail Armstrong, and I live in Magdalena, New Mexico. I represent District 49, which is Catron, Valencia, and Socorro counties. Thank you.
And Representative Joanne Ferrari.
Good morning, Mr. Chair. I'm Representative Joanne Ferrari from Las Cruces, House District 37, where we have a beautiful view of the Orphan Mountains, but I can't get it as a background.
All right. How about Representative Karen Bash?
Good morning, Mr. Chair and everyone. I'm Karen Bash, and I represent House District 68, which is the northwest corner of the city of Albuquerque.
Good morning, Representative. Representative Thompson.
Good morning, Mr. Chair. I'm Representative Liz Thompson, coming from you from the beaches in Tahiti, and I represent, I wish, the Northeast Heights in Albuquerque District 24, and this is my lovely granddaughter, Athena, and I'm babysitting today, so if you see me doing really weird things, don't call anyone, just realize I'm entertaining a 15-month-old.
Good morning, Athena.
What do you?
Representative Micaela Lara Cadena.
Good morning, Mr. Chair, and thank you. I'm honored to serve as the state representative here in District 33 in Doña Ana County, and today I'm participating virtually from home in Mesilla, just like you all have heard, but I have to keep saying it again. We don't have sufficient access for myself to be a working mom and my girls to be on school, and they start Zoom at 10. So I'm glad I got to say hello, see some pretty faces and great smiles this morning. But likely I will spend most of the day listening in, potentially just audio only as we get closer to my girls' start of school time. But glad to be in this conversation, and thank you.
Thank you, Representative. Senator Rodriguez.
Good morning, Mr. Chairman, members of the committee. I'm Senator Nancy Rodriguez, and I'm from District 24 in Santa Fe. And she's right. Great, beautiful faces and great smiles. Thank you.
And we have Representative Tara Lujan with us again. Welcome.
Thank you. Good morning, everybody. Yes, Representative House District 48 in Santa Fe County, diverse district all the way from our East Mountains to our west side, west and south side of Santa Fe. Happy to be here and looking forward to a wonderful committee today. Thank you.
Okay, good. Representative Willie Madrid, welcome.
Morning, Chairman. Thank you for having me today. And I'm a representative here in the south of District 53, which is butting up right up towards El Paso, Texas. It excites me to be part of this committee this morning and learn a lot. Thank you for having me, Chairman.
Great to have you with us, Representative. Then the co-chairman of the committee, Representative Armstrong, Debbie Armstrong.
Thank you, Mr. Chair, Representative Debbie Armstrong, and I represent District 17, which is the middle of the North Valley of Albuquerque. And I think we've got a great agenda today. I'm looking forward to it. Thank you.
Good, good. Let's have the staff introduce themselves. Why don't we start with you, Andrea?
Thank you, Mr. Chair. My name is Andrea Lazaro, and I am the lead staff member for this committee, and I am happy to be here today. If you need any assistance, please call me or email me. I can help you to the extent that I can. Thanks a lot.
And Sabina?
Hi, I'm Sabina Gaynor. I am another staff member, and I also can be emailed or called with any questions that may arise. Thank you.
Good. And then we have our host and all-around guru for the webcast, Nancy Martinez.
Well, thank you, Mr. Chair and members. I am Nancy Martinez and your host.
Am I missing any staff people? Please introduce yourself.
Mr. Chair, I believe Representative Garcia is on the phone.
Oh, good. Good morning. How are you, Representative? Did you want to introduce yourself?
Can you hear me?
Yes, can hear you fine, Miguel.
Oh, great. State Rep Miguel Garcia, House District 14. I'll be on the phone most of the day. I've been getting spotty internet connection here at the house for about 3 weeks now. I just came in from irrigating. We're kind of approaching the last days of the irrigation season, and we're cut out this Sunday, but the ditch rider put us back on schedule for today. So my district kind of includes some of the more historical parts of Bernalillo County and the city of Albuquerque, and it's an honor to kind of participate this morning with you all.
Well, welcome this morning. I hope you have plenty of water today.
It's coming in kind of slow, but I have a text to the ditch rider to speed it up. Thank you, Mr. Chair.
Thank you, Representative. And I see Representative Dow has joined us too. And and Representative, okay, so Representative Dow, did you want to introduce yourself? Maybe she's not on quite yet. How about Representative Johnson, Wanda Johnson?
Hi guys, I'm sorry I can't figure out how to get my video on, but hi everybody.
Now I'm not clear who that was.
This is Representative Dow. Sorry about that.
Oh, good, good.
My video wasn't put on for some reason.
Okay, do you want to introduce yourself and talk about your district?
Sure. Representative Dow, I'm a sophomore representative from Southern New Mexico. I call Truth or Consequences home and represent Sierra, Grant, and Hidalgo County.
Good. Good to have you with us this morning. Representative Johnson, are you on? And if you are, you make a quorum for us, so I hope you're on. You may need to unmute yourself if you're there. I see your name on the participant list. Oh, I see you doing chat. All right. She may need to call in, but it's great to have you with us anyhow, Representative Johnson. She's apparently having some trouble with the internet as well, but she is there, and if she calls in, we will consider her. And then Representative Black is here as well. Did you want to introduce yourself, please?
Sure. Good morning, Mr. Chair, members of the committee. I'm Representative Rachel Black, and I represent District 51, which is Alamogordo. Thank you, sir.
Well, it's great to have you with us.
Thank you.
And Okay, as I mentioned earlier, the agenda has been emailed to us. Oh, I should introduce myself too. Pardon me. I'm State Senator Jerry Ortiz-Pino. I represent downtown Albuquerque, Senate District 12. It also includes about 9 precincts west of the river in the South Valley and the UNM campus. Along with Representative Armstrong, I chair this interim committee. For those of you from NCSL and other presenters, this webcast is a pretty good indication of the kind of problems that rural states go through with limited access to broadband and undependable signals sometimes. But we'll muddle through somehow. And I want to remind the members of the committee that we have been emailed an updated agenda. It's changed from the original one that was posted. For those of you who are attendees, the public watching in, it's been posted there on the legislative website as well. And the first presentation this morning is on the general topic for the whole day, which is basically licensing issues, practice issues, scope of practice issues. It's one of the topics that we struggle with every session. There's several, if not more, than a handful of scope of practice and licensing, credentialing concerns. And we thought we'd start off this morning with a presentation from NCSL, the National Conference of State Legislatures, and 3 of their staff have agreed to present to us. We have Sydney Enland, the Health Policy Specialist, Iris Hentz, the Policy Specialist, and Zach Herman, Policy Associate with the Employment, Labor, and Retirement Program at NCSL. And so this will give us a good background of what's going on around the country regarding these issues. And then we'll zero in on New Mexico, and we'll do that around 11 o'clock this morning. So if our presenters are here, if you'd introduce yourselves, and we'll get started. And you can go in whatever order you want. We would like to save some time, enough time for the committee to ask questions. So whoever's going to kick it off, please get started. Thank you.
Sure. I'm going to share my screen. Can everyone hear me?
Yes.
Okay, great. Let's see here. right. So hello, Mr. Chair, Madam Chair, and members of the committee. Thank you for allowing me to be here today. It's nice to see some familiar faces from past NCSL meetings. My name is Sydney Enland, and I am a policy specialist in the health program at the National Conference of State Legislatures based in Denver, Colorado. I'm here today to talk with you about a few specific health licensing topics. However, I lead our program's work on the healthcare workforce, and I'm happy to answer any follow-up questions or talk more about scope of practice broadly, telehealth, recruitment, retention of providers, access to care in rural areas, and other topics at a later date if you see fit.
Sydney, just a second. I just want to remind the members that if you have, as the presentations go on, if you have a question that comes up and you want to ask it, you go to the participant button on the lower right-hand side of the screen, and there's a little hand at the bottom. You click on that hand and you'll go on the list to ask a question in your turn. I'm sorry, Sydney, go ahead, please.
No problem, Mr. Chair. Thank you. Just a quick overview of NCSL. We are your bipartisan membership organization made up of all 50 state legislatures in the states, DC, and the territories. We serve 7,383 state legislators and over 30,000 legislative staff. Our mission is to improve the quality and effectiveness of state legislatures, to promote policy innovation and communication among state legislatures, and to ensure a strong and cohesive voice in the federal system. And just a reminder that NCSL does not advocate for nor take any positions on state policy. So to no surprise, the coronavirus pandemic has dominated the healthcare policy landscape this year and will likely continue into 2021. And state legislators and other policymakers have played a key role in the response, introducing legislation on topics from budgets to education, legislative operations to public health, and many, many more. In fact, to date, state legislatures have introduced nearly 3,000 bills across all 50 states, DC, Guam, Puerto Rico, and the Virgin Islands in the 2020 legislative sessions on anything and everything related to COVID-19, as pictured here from NCSL's COVID-19 legislative database. The link is below the picture on the screen if you're interested in looking at legislation. Of those introduced, nearly 550 COVID-19 related bills have been enacted this year across all topics. If we take a closer look at health policy issues, our team has tracked nearly 200 enacted bills related to health and COVID-19. So even in this unprecedented time, state legislatures have been hard at work. To that end, I'm here to talk about scope of practice, certified registered nurse anesthetists, and mental health provider reciprocity. My colleagues Iris Hensey and Zach Herman will talk more about other licensing issues in a broader sense in just a little bit. Before diving into scope of practice, I just want to share a broad overview of health workforce trends we have seen in response to COVID-19. Out of concern that increases in COVID-19 cases may overwhelm the healthcare systems, several states have pursued policy options aiming to enhance and protect the healthcare workforce. 28 states, DC, and Puerto Rico have enacted legislation relating to the healthcare workforce and COVID-19, often relating to scope of practice, licensing requirements, and liability protection for healthcare workers. All 50 states and DC have modified licensing requirements and/or approval processes to recruit more healthcare workers during COVID-19 pandemic. Iris and Zach will speak more to this topic in a few minutes. Lastly, several states have pursued liability protections for healthcare professionals and facilities providing COVID-19 related services. At least 27 states, the District of Columbia, and Puerto Rico have provided some level of immunity for healthcare workers and/or facilities during the pandemic through executive or legislative action. 14 states, DC, and Puerto Rico enacted legislation specifically in response to COVID-19. A lot of these changes are effective only through the duration of the public health emergency, and this is an area we continue to track closely as we head into 2021. Into scope of practice, so during COVID-19, we have seen states modifying supervision requirements, especially as it relates to physician assistants and advanced practice nurses. Many states have waived or suspended supervisory or collaborative agreements for the duration of the emergency. Prior to the pandemic, some states had requirements in place requiring the supervising or collaborating physician to be physically on site where the NP or PA is providing care. After states of emergency were declared, and in some cases prior to the pandemic, states have modified statutory language allowing NPs and PAs to practice at a different site than the physician is practicing. Communication is still required between the providers and the physician if practicing off-site from each other. States have also increased the number of NPs and PAs a physician is allowed to supervise. Prior to COVID-19, some states allowed a physician to supervise only 2 or 3 NPs or PAs. In response, that number has increased to at least 5 and sometimes more. In response to COVID-19 and to allow more providers to practice in additional settings, Kentucky enacted Senate Bill 150, which authorizes the State Board of Medical Licensure, the Kentucky Board of Emergency Medical Services, and the Board of Nursing to waive or modify administrative regulations relating to scope of practice requirements to allow healthcare providers to practice in all settings of care. As enacted, this is effective only during the declared state of emergency. So certified registered nurse anesthetists, or CRNAs, are advanced practice registered nurses who provide anesthesia-related care in many different healthcare settings, including hospitals, surgical centers, obstetrical delivery rooms, pain management centers, and more. Prior to COVID-19, states were examining CRNA scope of practice relating to changing language around supervision versus collaboration and prescriptive authority. In Ohio, House Bill 224 passed the House January 29th and is still pending in the Senate. It seeks to clarify CRNA scope of practice regarding ordering medications, treatments and diagnostic tests in the perioperative period, and to remove some restrictions on CRNAs providing anesthesia care. South Dakota enacted Senate Bill 50 on February 26th, which authorizes CRNAs to collaborate and provide care with podiatrists and dentists in addition to physicians, and extend prescriptive authority and pain management to include controlled substances. Virginia enacted House Bill 1059 on February 3rd, and the bill gives CRNAs prescriptive authority for controlled substances to increase access to patient care. In response to COVID-19, a couple states have waived scope of practice requirements for CRNAs for the duration of the emergency. In Alabama, CRNAs may practice at their full scope of practice as determined by their education, training, and current national certification. In Maryland, healthcare providers, including CRNAs, may engage in activities not authorized by their license at a healthcare facility if doing so is necessary to allow the facility to meet required staffing ratios or ensure the continued and safe delivery of healthcare services. And these providers must be able to competently engage in their activities. New Jersey has also waived some statutes that previously limited a CRNA scope of practice as long as they are performing activities within their education, training, experience, and competence. Again, these regulations are only in place for the duration of the emergency declared in those states. Again, in response to COVID-19, a few states have made changes in regard to reciprocity with mental health providers. In Delaware, the governor released a joint order that authorizes all out-of-state mental health providers with an active license in good standing in any U.S. jurisdiction, including psychologists, mental health counselors, clinical social workers, chemical dependency counselors, and marriage and family therapists, to provide in-person and tele-mental health services in Delaware. This is a temporary order and is effective only for the duration of the state of emergency. Missouri enacted House Bill 2046, which removes reciprocity exclusions for various professionals, including those licensed under the State Committee of Psychologists, and requires licensing reciprocity for these professions to be the same as any other licensed profession. This bill was introduced in January, but was modified after the declared emergency. the North Carolina Governor issued Executive Order 116, which temporarily waives licensure requirements for healthcare and behavioral healthcare personnel who are licensed in another state, territory, or DC to provide health services within the state. Vermont enacted House Bill 742, which deems a healthcare professional, including a mental health professional who holds a valid license, certificate, or registration in any other U.S. jurisdiction, as licensed to provide services in Vermont via telehealth or as a staff member at a licensed facility during a declared state of emergency only. This bill was introduced in January and again modified after the declared emergency. So before wrapping up, I just also wanted to briefly mention telehealth. All 50 states, DC and Puerto Rico have made revisions to their telehealth policies during the pandemic to maintain access to care services and minimize potential exposure. And legislatively, it's a policy area we've seen a lot of action in the past few months. We've seen a wide range of modifications to telehealth policies, but most states have made changes to allow reimbursement for telephone calls, the types of providers authorized to provide telehealth services, and the removal of a prior patient-provider relationship. We're also seeing trends of requiring mental health services provided via telehealth to be reimbursed at the same rate as in-person services. Again, most of the modifications are temporary for the duration of the pandemic, but we will be keeping a close eye on whether these will become permanent during future legislative sessions. That concludes my part of NCSL's presentation. I'm now going to turn it over to my colleague, Iris Hensey.
Awesome. Can everyone hear me? All right, great. Well, thank you so much, Sydney, and thank you, Mr. Chair, as well as Andrea, for inviting us to present today. My name is Iris, and I'm a policy specialist in our Employment, Labor, and Retirement program, where I specialize in occupational licensing and regulatory policy, as well as general workforce development and discrimination. Ooh, I heard a little feedback. Let's see. All right, I'll give it a go again. So I specialize in occupational licensing policy as well as regulatory policy, general workforce development, and discrimination in employment issues. So Zach and I will be covering quite a few general licensing topics for you today, and we'll be trying to keep it as succinct as possible. We'll be diving into reciprocity, issues surrounding COVID-19 and licensing, state regulatory structures, and regulatory efficiency. Could I get the next slide, Sydney? So just briefly to get us started, NCSL has been working on a multi-year occupational licensing consortium project in partnership with the Council of State Governments and the National Governors Association. The two big components of the project are really research in best practice in areas of occupational licensing policy, as well as hands-on technical assistance that we provide a group of 16 states that we're working with closely. On this slide, you can see what some of those states are, and we also have the web address for our project landing page here. And with that, we'll go ahead and get into our first topic, reciprocity and streamlining of credentialing. Next slide, please. Great. So for pre-COVID-19 trends, I'm really talking about legislation that impacted occupations and professions broadly. Then when I get to COVID-specific trends, I'll be speaking more about health professions specifically. So coming off of legislative sessions in 2019, general mobility and interstate compact issues were at the top of the list in terms of trends. In 2019, states introduced nearly 100 bills on these topics, and they vary to cover everything from legislation that would enable a state to join a new compact to legislation setting up reciprocity agreements between states. 2019 also saw 182 bills introduced in states on requirement clarification topics. These don't necessarily all cover reciprocity, but many of these did make modifications to existing reciprocity statutes, potentially making it easier for workers to cross state lines. Another popular topic in licensing over the last 2 years has been the adoption of universal licensure laws by a handful of states. Universal recognition is the endorsement of licenses in good standing held by an individual practitioner in another state as valid qualification for licensure in that state. Arizona, Montana, New Jersey, and Pennsylvania all enacted legislation on this topic in 2019, and each state's bill truly looked a little bit different. For example, the legislation that Arizona passed laid out the requirements an applicant would have to meet, like being in good standing with their original license and being licensed for at least a year. But most of the rest of the Arizona bill focused specifically on disqualifying criminal history of an applicant and what the state would do if that applicant had a criminal history. Pennsylvania's legislation from the same year was similar, but instead of kind of focusing on the criminal history aspect, they also included language around the requirement of demonstration of competency and requirement of continuing education for licensees. Then further still, the bill that was passed in Colorado in 2020 was different in that it created a credential portability program, allowing individuals to seek licensure by endorsement, reciprocity, or transfer in the state, but only for specific professions and occupations outlined in the bill. So it's still really unclear how all of these different state approaches are going to mesh and work together. Two other pre-COVID-19 trends that were popular were states making changes to the way that they approach licensing for both individuals with criminal records as well as military spouses. For military spouses, the biggest issue has been reciprocity, as they tend to move frequently between states. So many states have passed legislation recognizing licenses from other states for military spouses, or have passed legislation that otherwise makes it easier for these folks to ultimately get to work in their new state. And for folks who have been involved in the justice system, that criminal history that they carry can be a very difficult barrier to overcome in seeking professional licensure. In 2019, 94 pieces of legislation were introduced on the topic across all states, with 43 bills ultimately being enacted. A majority of these measures were doing one of two things. The first was removing the requirement that an applicant be of good moral character to get a license. These good moral character clauses are typically a rather subjective term used in statute that may not necessarily measure an individual's ability to perform their job or work in a given profession. And the second thing that a lot of these bills did was preventing boards and licensing agencies from outright denying an individual a license or from refusing to review their application based solely on a criminal history. Next slide, please. So COVID-19 has had a very robust, at least in the short term, impact on occupational licensing. And just as a quick reminder, I'm talking about healthcare professions now with these trends because they have really seen all of the regulatory changes due to the pandemic. So this spring, when the pandemic first took hold, states were scrambling to figure out how to address it in pretty much all aspects of state government. In licensing, this translated to temporary executive orders, making changes to the requirements, processes, and procedures related to licensing. We'll get into what some of those changes have been more specifically here in a second, but kind of broadly speaking, they either made very specific changes to existing requirements, or they gave boards and licensing agencies broad latitude to make changes as they saw necessary to the pandemic. So at this point, you know, kind of early on in the fall here, we've seen some states rescind those executive orders. Wisconsin was one of the earliest when their state Supreme Court ruled that their pandemic-related executive orders exceeded executive power, and that also included their licensing-related executive orders. But since then, other states have had their orders lapsed, haven't necessarily reinstated them, while some others have gone ahead and decided to extend them through October, through November, or even through the end of 2020. And in terms of the actual changes that were made, we saw a lot of approaches that we've seen in the past adapted to the COVID-19 context. Reciprocity measures kind of as Sydney already touched on, were the most widely adapted of these, and we'll talk a little bit more about them here shortly. But we also saw some innovative approaches to get more folks licensed and working in healthcare professions. One example is that a number of states encouraged recently retired healthcare workers to return to work without having to start the licensing process from scratch. Some of these states allowed retired workers to practice immediately, while others still required some form of regulatory review, such as going through a reactivation process. But in all cases, workers didn't have to provide any additional information or pay any additional fees to go back to practicing. California, Colorado, Louisiana, and Oregon are all examples of states that pursued this approach. Next slide, please. So again, increased reciprocity was really the biggest and boldest trend that we saw from states in reaction to the pandemic. Temporary changes to allow for greater reciprocity included just relaxing some of the regulations that exist. Many states did this to allow professionals who were licensed elsewhere to practice in their jurisdiction without seeking licensure or even regulatory review. Many states were essentially saying that if you're licensed and in good standing with your home state's board, then that's good enough for us. And we trust that your home licensing board or agency did their due diligence to make sure that you're fit to practice. Many states were allowing folks to license elsewhere to practice immediately, while others were still requiring some form of regulatory review. The states that were still requiring regulatory review were harnessing either temporary or expedited licensure to ensure many workers were able to get to work as quickly as possible. Then a more novel approach that we've seen to reciprocity as well is that some states are accepting foreign licensure and training, which is something that was quite rare beforehand. For some of the states that are allowing foreign trained healthcare workers to practice, like New York, New Jersey, and Nevada, they're still requiring a provisional or temporary licensure, and applicants do have to go through the vetting process. But accepting foreign education and training has often been perceived as an even bigger stretch for states than accepting one another's education and training standards. So these actions have been really notable. And finally, at the federal level, the Centers for Medicare and Medicaid Services have been temporarily waiving requirements that out-of-state practitioners be licensed in the state where they are providing services. Licensure is really a state-driven institution, but the federal government can do certain things like this to encourage states to make changes to the way they approach licensing. Next slide, please. So looking ahead to 2021, it's of course always hard for us to tell from a policymaking perspective what's going to happen. When it comes to some of the pandemic-related licensing actions, we've heard from academics and think tanks that operate in the licensing space that are urging legislators and other state policymakers to consider extending some of these measures beyond the pandemic and into the future. The argument is essentially if we were able to continue to operate and provide care to patients during this time with relaxed regulations and nothing fell apart, maybe we can look at making some of these temporary changes permanent. At NCSL, we're of course most in tune with state legislatures, and we tracked that in March and April of this year, a time when the majority of states are usually in session. 35 states had their 2020 sessions postponed or decided to adjourn early due to COVID-19. Several of those states have gone back since then to have special sessions or continue with the remainder of their regular session that was interrupted. And we were watching closely to see if legislators would start to take up these issues. But we didn't really see much of that at all. It could be because state budgets are really the issue at the top of everyone's minds right now, or it may be because many states feel like it's a little bit too early on in the pandemic still to really understand how things are going to shake out. Regardless, we didn't see the legislative action on COVID-19 related to licensing that we had initially expected to see. With the increase in licensure reciprocity among states, it's very possible that the current pandemic and economic climate that we're in will continue to push states to work more closely together. We've seen an increased appetite among states to improve and increase reciprocity with one another, and that could be bolstered further by the current situation. Next slide, please. So next up, we're going to shift gears a little bit and get into state regulatory structures and how states have their occupational regulation mechanisms structured. So NCSL, in collaboration with the Council on Licensure, Enforcement, and Regulation, or CLEAR, recently published a report looking at regulatory structures in states across the country. CLEAR is a membership organization for regulators in the US, as well as internationally. And we collaborated on a survey of states, ultimately receiving 161 responses from 45 states and the District of Columbia, reporting on regulatory structures in their jurisdictions. So on this slide, there are kind of 5 different broad models that a state can identify as in use in its jurisdiction. These models are based on previous research and best practice in this area and can be placed on a continuum from board dominant structures on the left to more agency dominant structures on the right. This is captured on the slide. So the first model here, Model A, is fully autonomous or independent, meaning boards have their own staff, they handle their own finances, they set policies and procedures, they set requirements for licensing, and they oversee all of the administrative functions of licensing. Moving from left to right, the next model, Model B, is characterized by autonomous boards, but with a central agency responsible for basic housekeeping functions. So the boards make decisions on policy, licensing requirements, exams, discipline, and staff, but a central agency does exist to help with anything from providing office space to collecting fees to issuing licenses. Moving on to Model C. In Model C, boards maintain decision-making authority in many areas, but a central agency now has increasing responsibility beyond housekeeping to include some responsibility over the budget, over personnel, and over issuing licenses and conducting investigations. Next up, Model D shifts into a central agency with a heightened level, excuse me, of decision-making authority on all substantive matters. So the individual boards still exist in this model, but they are delegated responsibility for things like the examinations, recommending standards, and recommending disciplinary sanctions from the central agency. The central agency still must work alongside boards in many ways in this model. And then finally, all the way to the right, we have Model E. In Model E, the central agency really has all final decision-making authority, and the boards may exist, they may not exist, but if they do exist, they likely serve in an advisory capacity only. Next slide, please. So we have our 5 different models, and they each represent a different approach to state regulation. But then we added another layer of complexity because according to the research that we did, a lot of states are using more than one model at the same time. So this chart shows that 20 states indicated that only one single model was in use, regardless of the number of boards existing in the state. 15 states indicated that they used 2 models simultaneously, and 11 states said that they used 3 or even more models in their state, kind of depending on the profession or the occupation in question. Next slide, please. Then this map is another way of showing the data. The map key down at the bottom is a little bit fuzzy, but hopefully you can see that the states in red are using a single model in their approach to the regulation of professions and occupations. The states in yellow are using 2 models, and you'll note that New Mexico falls in this category. And then the states in gray are using 3 or more models simultaneously. Next slide, please. So going back to the types of models states employ, according to the research, New Mexico currently uses 2 different models, Model C and Model D, which are both bold in red here. So Model C is kind of right in the middle in terms of board dominance versus agency dominance, with a central agency and boards both kind of sharing that regulatory authority. Then Model D trends slightly more towards central agency authority, where the agency has a little bit more of the power and the ability to delegate out to the boards. There is only one other state that utilizes the same combination of these two models, Model C and Model D, as New Mexico, and that state is Wisconsin. Next slide, please. So I'm not going to get too in-depth on my coverage of New Mexico's regulatory structure, because I'll really let the experts who are slated to present next on the agenda, Marguerite Salazar and Linda Trujillo from the Regulation and Licensing Department, tell you so much more about the local context here in New Mexico. But I will go ahead and report on some of the data that we got for both Model C and Model D. Next slide, please. So on this slide, we have some of the takeaways from our data on both of the models that are in use in New Mexico. Respondents indicated that there were both challenges and benefits to each model, really. So first up, some of the challenges that came up in the data were mostly based on efficiency and communication and collaboration. When it comes to efficiency, respondents cited possible drawbacks from the power sharing that can occur in both of these models between the boards and the agency. Respondents also pointed to turnover in staff at the agency and a potential lack of dedicated staff to certain boards as some of the issues they're familiar with in their states. The other big challenge with the regulatory models New Mexico employs go back to the power sharing between boards and agencies, and how sometimes that back and forth can result in things getting lost, or perhaps a certain tension between the different powers in play. But the research also points to some key benefits of using these models, including both budgetary benefits and streamlining and standardization benefits. So when it comes to budgets, respondents pointed to the possibility of resource sharing between the agency and the boards, as well as among the boards, as a really big benefit. Resources were noted as both personnel and funding in our data. One of the other key benefits of the models New Mexico employs is the ability of the Regulation and Licensing Department to work with the boards to provide a consistent service to consumers and licensees. The presence of the department helps to streamline the ultimate interactions users are having with the regulatory system. And with that, I'll go ahead and turn it over to my colleague, Zach Herman, who will talk a little bit about regulatory restructuring.
Thank you, Iris. Thank you, Mr. Chair and Madam Chair. So in my section, I'm going to provide a couple of sort of case study examples from some of the states we've been working with in our consortium who have recently done some regulatory restructuring. And then I'll also cover some general efficiency measures that we're seeing a lot of states either express interest in or begin to adopt. So our first example is from Vermont. Vermont is a centralized agency structure, so a Model D, Model E, and recently they transitioned their real estate board from an independent board, which allows them to have their own staff, promulgate rules and things like that, to an advisory board under the Office of Professional Regulation, which is the centralized agency in Vermont. Next slide. So the restructuring process in Vermont took about 2 years of iterative work. They began by engaging stakeholders. These were both licensee holders and the board members on the board themselves. They used these engagement sessions to gather information on how members felt about the boards, what board members felt their role was, and use that information to map their process forward. They also began with an intense review of the existing code on real estate boards to make sure that when they began drafting changes, that they were not getting issues with authority mixed up. They delivered a report on the code review, and then in that they engaged stakeholders another time, asking for stakeholders to provide feedback on that code review and on their research. From there, they then drafted rule changes and then promulgated those revisions. Next slide. Lessons learned from this change in regulatory structure in Vermont is that the process is iterative and it often takes a while. Key stakeholders should be engaged early and often, and an extensive review and revision of existing code is often necessary to assure that there are not issues of authority or gaps in the new legislation. Next slide. So next, we're going to look at a large regulatory restructuring that happened in New Hampshire. So in 2016, New Hampshire transitioned from Model A with fairly independent boards or almost entirely independent boards to a more centralized agency model. The initial goal of this was to increase shared administrative costs and increase both standardization and efficiency of new licensure processes in New Hampshire. Next slide, please. So this process is still ongoing. There was the initial restructuring in 2016, and then in 2018, greater authority was given to the agency to allow for more standardization and streamlining and sharing of administrative costs. In that, there was a lot of upheaval amongst the boards, and in an internal review of the code, there were issues of authority between who was in charge of certain administrative processes versus others. So in 2019, there was a reorganizing of the agency internally. So instead of organizing staff around certain boards, they organized staff around tasks. Instead of having staff dedicated to their medical boards and their professional boards, they organized staff around discipline, licensing, criminal records, and mobility to allow for greater efficiencies within the agency, and also began their review of authority within code. And that was both the code for the centralized agency and for the code for the boards that they reviewed. In 2019, they then issued legislation to clarify these agency issues of authority. And that bill is still sort of on the table waiting for 2021. Next slide. So lessons learned, board training is critical for success. One of the major issues in the transition were that boards did not fully understand the process or what the changes meant for them. And so having board training early on would help the transition move more smoothly. Authority in these transitions should be clearly delineated in statute. Again, the process is very iterative, and that board buy-in from the beginning of the process is often essential. And then organizing the agency by job function instead of subject matter expertise often allows for greater administrative efficiency. Next slide. So finally, we're looking at the two other efficiency measures that are coming up in states. These are sort of mid-level regulatory restructurings. These are sunrise and sunset review processes. We're going to keep this sort of very high level. Sunrise review is when evaluations of new regulations, often for licenses, happen before the license is put into legislation or the potential new profession is codified. These examine often the potential impacts, costs, and benefits of the new regulation and are generally done either by the Legislative Council or by the centralized agency. We currently know of about 14 states that have a sunrise review process, and they're usually used in tandem with their sunset review process. Next slide. So sunset reviews are regular reviews of existing regulations and programs. They are often focused on licensing requirements themselves. We know of 36 states that have some sort of sunset review. This includes New Mexico, and they take place after the legislation is enacted. They're often rotating regular reviews where each profession is reviewed generally every 6 years. And these will look at requirements. How do those requirements relate to other states? What are the costs associated? And then the reviews will also come forward with suggestions, whether regulations should be changed, adapted, if the profession should continue to be licensed, or if it should be moved to a certification or a registration or delicensed entirely. We've seen a lot of states express a lot of interest in this. And last year, Arkansas passed legislation that, among many other things, instituted both a sunrise and a sunset review process. And then next slide, please. So that's the bulk of our presentation. Thank you again, Mr. Chair and Madam Chair, and we are open to questions.
Good. Did you have any final statements, Iris or Sydney?
No, just happy to take your questions.
Okay, great.
Yeah, nothing from me either. Thank you, Mr. Chair.
Thank you. Thank you. Thank you all. Great presentation. Very interesting what's going on around the country, both before and after COVID. And we have a number of questions from committee members, so we'll get started. We've got the next presentation at 11 members, so we have about 50 minutes, which should give us plenty of time to cover these topics. So we'll start with, I think Representative Gail Armstrong had your hand up first. You want to get started?
Thank you, Mr. Chair, and thank you all for your presentation. Great information. Love that you're bringing this up at this time. I had written a letter to the governor early August asking to, we do have reciprocity for some agencies, but I was brought to my attention about some counselors, behavioral health counselors and therapists that couldn't get the reciprocity, didn't qualify because ours is a little more restrictive than other states. And so I keep wanting to get an answer. Unfortunately, the governor hasn't answered me yet. It was directly to the governor to expand this reciprocity only through the pandemic. And it would be under the Uniform Emergency Volunteer Health Practitioners Act is what I had suggested to her. But anyway, I just really appreciate that states are being bold, and this is so needed in our state right now. In my little small town, I see not only a pandemic, but I see a pandemic in the health industry that people are having lots of mental health issues, and especially children that are starting on hybrid models or whatever their districts have decided to do. So I just wanted to say kudos to you all for bringing this information up, and thank you, Mr. Chairman, and Madam Vice Chair, for bringing this to everyone's attention. And so any help with the governor, I would appreciate it. Thank you.
Good. So then we go to Senator Antoinette Sedillo Lopez, followed by Senator Nancy Rodriguez.
Thank you, Mr. Chair. Being relatively new to the legislature and sitting on these committees, I always wonder what exactly is, as I think about legislation, what exactly is the risk that we're trying to prevent by licensing at all? What are the goals we're trying to achieve when we license?
Thank you, Mr. Chair, members of the committee. I'll take a first stab at this, Sydney, and then if you want to go ahead and jump in from a health perspective, feel free. So I think the biggest thing that we tend to hear from states, from a lot of different constituents, from different associations related to professions that are licensed, is that health and safety argument. Right, so it's that by licensing whatever occupation it is that you have in mind, you are somehow allowing the state to do a review of an applicant to make sure that you are upholding a certain level of health and safety in that occupation. And so Zach and I both work kind of more broadly in licensing. And I think that there are certain occupations where the public health and safety argument is really strong, right? Something like healthcare, anything related to giving care to a patient. That argument is certainly going to be received fairly well. I think there might be some other professions outside of the health area where the argument for public health and safety isn't quite as clear. There have been, the one example that always comes to mind is in Louisiana, florists were licensed for a number of years. They have recently kind of worked to get rid of that licensing, but it's like you're arranging floral arrangements, you necessarily need a license to do something like that. So I think it really comes down to the public health and safety argument, and it's just so contingent and specific from occupation to occupation. And Sydney, I don't know if you want to jump in from the health perspective.
Yeah, I would. Thank you, Mr. Chair, and Senator Lopez. That's a really great question. I echo everything Iris said. I think, especially related to health professions, the health and safety of providers and where they're working in the communities is really important. And I think Iris and Zach do a lot of the sunrise and sunset reviews. But that's at least in the health professions where I see a lot of looking at health and safety for licensing providers is through the sunrise period, and then reevaluating, especially if it's a new license coming from a certification to the licensure, looking at that during the sunrise. And then most states, Iris, correct me if I'm wrong, or some states will have that sunset review period after a number of years, where then they'll go back and re-examine and say, did this meet health and safety? If so, we'll continue. And, sometimes they'll make it permanent, and sometimes they'll still have another review period and they'll still reevaluate at the end. So, it really does, it varies by state, but I would say the health and safety is the most.
Thank you, Mr. Chair. And the reason I ask is I remember this is years and years ago, there was a dentist practicing, I believe, in Valencia County. And come to find out, he lost his license here in New Mexico, but come to find out he had moved from another state and had a history of disciplinary complaints and alcoholism. And so he left that state, and I don't know what the licensing is like in New Mexico, or was at that time. And he came here and ultimately lost his license here. And so it seems to me that their history and record in the prior state should be really given priority if we're looking at protecting the public. And I really liked your answer, because I think that that's what we need to focus on and focus the boards on, is what is necessary to protect the public, and what other kinds of requirements are maybe just protecting the profession from competition. And I think we need to focus on the public health angle, or the public safety angle. And then I just had a small question for Mr. Zach Herman, and that was when you went through your slides, one of the things you distinguished was between an agency that, if I understood you, focused on job function versus expertise. And I don't know the difference between that. What does that mean? I'm sorry, I just didn't understand it.
Thank you, Mr. Chair, Madam Vice Chair, and Senator Lopez. So expertise refers to the specific job. So that would be expertise in like orthopedics or dentistry or engineering. And then job function refers to the specific task within the day-to-day regulating of occupations. So that could be disciplinary investigations, reviews of applications, background checks, collecting fees, and things like that.
So function would be, I'm sorry, so expertise was somebody who knows the area real well, and so that they would be able to gauge that person's proficiency. And function would be, just to clarify, somebody who is just looking at their background and making a report on their background?
Correct.
Wouldn't you want both?
Yes, and so that was a lesson learned from New Hampshire specifically, was to organize all of the, per se, disciplinary investigators into one category so that they could collaborate across those disciplinary investigations to increase that efficiency. So they would also still have their subject matter expertise, but they were organized into groups based on function, as opposed to having all of the experts within the agency related to the medical boards doing all of their investigations separate from another, like from the engineers and from all of the other professions. And so that was a lessons learned from New Hampshire and what they found to be most efficient in their reorganizing.
Thank you, Mr. Chair. That clarifies that point for me because it went by and I was just like, what did that mean? So I appreciate that. That's all I have, Mr. Chair. Thank you.
Thank you, Senator. Next, we go to Senator Rodriguez, and she'll be followed by Representative Debbie Armstrong. And I would remind people, after you've asked your question, don't forget to take your hand down. Senator Rodriguez.
Thank you, Mr. Chairman, and thank you to the presenters. I have just a quick question for Sydney. Sydney, you mentioned something about waiving the requirements to allow practitioners to practice medicine in all scopes of work. And of course, I like that. But tell me a little bit about that. Would a professional, for example, a specialist, be able in GI tract or hepatologist be able to practice in other areas also during this COVID with this waiver that you're talking about?
Thank you, Mr. Chair. Senator Rodriguez, are you referring to the Kentucky bill that allowed all practitioners to practice wherever?
Yes, thank you. I think it was Bill 150. I can remember.
Yeah, so, that was one of the things we've been looking at is what really are states doing to increase access during the pandemic and make sure, especially in the rural areas, it's mostly what I track is, access to care in rural, and scope of practice is one of those things. And the Kentucky bill only allows professions that are licensed under the medical board, the Emergency Medical Services Board, and the Board of Nursing to waive certain regulations related to their scope to allow them mostly to practice maybe in different settings, to do additional procedures, to waive the supervisory relationship language that a physician assistant or a nurse practitioner or what have you needs to have that like direct supervision. A lot of states have that. And we've really seen that's probably the biggest scope of practice change or trend that we've seen during the pandemic response is waiving those collaborative agreements or supervisory agreements between providers and their supervising physician to allow them to have more flexibility in where they're providing care and who they're providing care to. Kentucky's really the only state we've seen that has done like a blanket, we're allowing providers to practice in additional settings. Most states have really just focused on just waiving the supervisory agreement and the collaborative agreements.
I see. Okay. Thank you very much for that. I think it's a great idea to do everything we can to provide more accessibility for medical services. I thank you for all that you do. Mr. Chairman, that's all I have.
Thank you, Senator. Actually, before we go to Representative Debbie Armstrong, we'll go to two other representatives who have asked to have questions to ask. Let's start with Representative Thompson and then Representative Ferrari.
Thank you, Mr. Chair, and thank you so much, NCSL, for the presentation. This is not supposed to be a trick question, and it may not have an answer, but have you found in your research that there is a best practice in terms of how to do the licensure, particularly around healthcare professionals, but my guess is it probably depends on the state, but is there a gold standard? Is there a best practice? Thank you, Mr. Chair.
Thank you, Mr. Chair. Thank you, Representative Thompson. I'm going to kick that to Iris just to talk maybe broad, Iris, we can collaborate for talking about licensing more broadly. Does that work?
Yeah, that works. All right. Well, thank you, Mr. Chair and Representative Thompson. I am so sorry I can't give you the kind of golden ticket bullet answer. Really, it depends on the state, which is what we hear so much of in policy, right? But there are a lot of different approaches. Some states, like New Mexico, for example, have a centralized licensing agency, and that might work really well for you. Some states can be completely board driven, and that might work super well for them, just in terms of structure. Some states are known for having kind of very difficult licensure requirements, whether that's for teachers or healthcare practitioners or, cosmetologists. And they feel really strongly that those requirements keep a certain level of applicant from maybe necessarily being able to get into their profession, and they're, as a result, being able to provide the best services possible. Their licensees are, of a higher caliber, maybe. That might work really well in one state, but in other states, they might want to keep it more open and try to get as many folks as possible to work, and try to get as many folks in rural communities or underserved communities the kinds of healthcare that they need, the kinds of teaching access that they need. So it really depends on all of these different competing variables. And then on top of that, you add all of the different stakeholders that are involved in these processes. So it's very specific. Sydney, I don't know if you have any best practices around healthcare to share.
Thank you, Mr. Chair. I would just echo what Ira said. And, we say this in our health program all the time. If you've seen one Medicaid agency, you've seen one state's Medicaid agency. And I would kind of say that for even licensing boards, and even within the states for healthcare providers, one board may be licensing or certifying providers differently than another board, or, certification board, licensing board, or agency. And we'd be happy to follow up with more examples. And, us at NCSL, we can't really say like, this state does a really good job. We can really say these are what are the options states are doing in terms of their licensing. So it is kind of a trick question, because we can't say there's really no answer, but I will say it does vary greatly state to state.
And Mr. Chair, Representative Thompson, just one other thing that I'll add is that I think that we really do see a very strong role for legislators, though, who want to be involved in these discussions and, work really collaboratively with your regulatory agency or your regulatory boards. There are a lot of different things and a lot of different levers that legislators can kind of pull to swing your state in one direction or another, kind of depending on what values are most important to licensing to you. So I think that, the more information that you have and the more kind of information we can help provide you will hopefully make sure you're equipped to kind of tackle this really sticky, weird policy area.
Thank you, Mr. Chair, and thank you for the answer.
Thank you, Representative Thompson. And next we go to Representative Ferrari.
Thank you, Mr. Chair. I'm not sure who to direct this to, but I was wondering, when we have state certification for just certain state providers, such as in the guardianship program, and then there's programs or guardianship through the courts that rely on federal regulation and licensing. And then if someone is found not to be licensed by either, and yet they're practicing in our state, would that become the responsibility of the federal licensing for that guardianship provider?
Thank you, Mr. Chair. Representative Ferrari, that's a great question. I do not have the answer to that. I don't know, Iris or Zach, if you know anything related to that topic.
Thank you, Mr. Chair and Representative Ferrari. No, I can't be of any help. Sorry, Sydney.
That's all right. Representative Ferrari, I'd like to follow up with you after the meeting, and we can get that question answered for you.
Oh, I appreciate that so much. Okay, thank you.
Of course.
That's all, Mr. Chair. Thank you.
Okay, thank you, Representative Ferrari. Representative Debbie Armstrong.
Thank you, Mr. Chair, and thank you, presenters. This was really helpful and it gives us a lot to think about as we go through our day. I did want to make one correction that I think is pretty major, that unless I'm totally wrong, but I don't think I am, and I did a quick look online in our statutes. But we also have in the structure of our the different models that Iris, I think you talked about. We also have Model A in healthcare. So we have an independent nursing board, medical board, osteopathic board that do their own. I only looked quickly at the nursing board, but they don't fall under the department, and they do their own rules and regs. So I just want, because the public is listening, and we're going to hear from them next. I'm sure they're all going, what? We're independent. So I just wanted to make that correction for New Mexico. So puts us in a small minority, I think, with 3 or more models. But that makes it's an important point, because it makes it, I think, confusing to the public and maybe even some of us as to who has what authority to do what, and what authority that the in an emergency that the executive might have in regards, if they're not under this state agency but independent. It may be a little different. I hadn't thought about that, whether that impacts the governor's ability in an emergency executive order. But it does, having a hodgepodge probably makes things a little more difficult. So anyways, no particular questions, Mr. Chair. I just thought it was important to point out we do have a number, particularly in healthcare, but also outside of healthcare, I think. We have some independent boards. Thank you.
Great, and thank you, Mr. Chair and Representative Armstrong. Thank you so much for that correction. I really appreciate it. I think that we probably in our research, we're looking most closely kind of outside of the healthcare scope. We have kind of a confusing way that we divide these occupations, where Zach and I really work on the non-healthcare side of things, and then Sydney works on the healthcare side of things. So I think that in our research, we were looking outside of any sort of healthcare occupations with that. But that is a very important point, and I'm happy to make sure that our resources are corrected as well on our end, so we have the most accurate and up-to-date information.
Thank you. Thank you. I appreciate that, and I didn't really mean to call you out as making a mistake, but it's important in our topic today. I'm sure it'll come up, but I think it's important for us to consider how that may make things operate a little different, particularly in the healthcare arena when we've got both independent and under an agency purview. So thank you. Thank you, Mr. Chair. You are muted, Mr. Chair.
Then this is something we'll want to ask the superintendent when she comes up later this morning. And Representative Lujan, your hand is up. You have a question?
Sorry, I'm trying to unmute. Yes, I do. And I might have missed some of the presentation, but I think this would go to Sydney. And I just wanted to ask, pertaining to the policy aspect, in New Mexico, we have the Emergency Licensing Act from 2003. And look, it seems from my understanding that it addresses some of the policies that you mentioned that are being addressed across the country because of the pandemic. And I'm wondering, with that in place for New Mexico, have you reviewed that, and have you found any areas within that act that you would like to amend or work around or address?
Thank you, Mr. Chair, and thank you, Representative. I have not really looked into the Emergency Licensing Act. Iris, jump in if you guys have, just in terms of emergency licenses. I did come across it when I was doing some research on the CRNA policy, and that there's also one that allows states to kind of opt out of their, for CRNAs to opt out of physician supervision in those emergency acts. And I do believe New Mexico is a part of that. I know states are really looking at that now. Arizona and Oklahoma were the two states that were added this spring that have done that. And I think that brings the total to 18 or 19 states, I think. But, and as us as NCSL, we can't really say, what we would change or what we would do about it related to the act. But we'd be happy to work with you in terms of what other states are doing, in terms of what kind of processes they have in place around that.
Okay, thank you. I appreciate that. I just wanted to remind you, or to let you know that we do have this act in place, and that it is a good place for you to find some research information as to what we're doing or how we're handling things here in our state, because we do have something in place. Thank you.
Now, there are a couple of other hands up, but I don't know if it's for second questions or if you just forgot to take yours down. Representative Ferrari, did you have a second question? Okay, well, we'll just remind her to take her hand down if she doesn't have a question. Anybody else with a question? I've got a couple of things I wanted to bring up. You didn't really address the issue of interstate compacts on some of these professions, and that's been a difficult issue for us here, largely because we had, I think, 48 hours to get the interstate nursing compact through a couple of years ago, and it created an incredible amount of heartburn. But we finally did it, and it was over the objections of lawyers. And one of the issues that the defense lawyers, trial lawyers bring up all the time when we are discussing compacts is you're limiting New Mexicans' abilities to use the courts to protect themselves from malpractice. And I wondered if the whole issue of compacts, and we, for example, we turned down the psychologists, interstate compact on psychologists, over that very issue, that it somehow impinged on the state's sovereign ability to make its own regulations. What are some of the trends nationally on these interstate compacts? I know the psychologists are wanting to bring theirs back up again. There may be others as well, and I'd love to hear what NCSL's take is on that issue.
Thank you, Mr. Chair. Yes, compacts have been a huge trend prior to the COVID-19 pandemic, and even more so as the pandemic has really taken off. Zach, please hop in with your knowledge of the compacts as well. We have seen a lot of movement around the psychologists compact. I know North Carolina just passed this year, they joined. So we track that. We track a lot of the physical therapists have a compact now. EMS providers have a compact. And more and more states are, trying to join every year. One of the things that I do hear from some legislators who are concerned about the compact language is that, they have to adapt the universal language to their states. That, you did mention, Mr. Chair, that you don't really have any control of what language is included in that bill. As if you want to join the compact, you have to adapt the exact language, and there is some concern around that. But I'm gonna turn it over to Zach. I'm sure he has some more to add.
Thank you, Mr. Chair. And so compacts do make regulation a little bit more complex. They do not affect the state's own regulation for licensing new licensees. And people who don't qualify necessarily for a compact license can still get licensed in New Mexico based on those own requirements that they have outside of the compact. The compact also doesn't affect things like existing reciprocity agreements or licensure by endorsement or things like that. It's more of a add-on than it is a restriction on existing regulation for licenses.
Well, thank you. It's usually billed, at least the nursing compact was billed that way, as and I think the psychologists as well, as a method for us to be able to more rapidly have access to the professional skills of those professions that are covered by the compact, so that nurses would freely be able to move back and forth. Psychologists would be able to, if they're licensed in another state, even using telemedicine, be able to bill and so on. It's an issue that we're going to have to face. I know the psychologists and the physical therapists are bringing theirs up this year for us, so we'll have others. And I wanted to ask also about an issue that's related to what you're talking about, and that is once somebody's licensed in the state, that's fine, but if they can't get paid by the Medicaid program or by the HMOs running the Medicaid program, that basically limits where they can practice. And so they may be licensed, but if the clientele in the community where they're living is 80% covered by Medicaid, and they're not certified by any of the HMOs, or if they're not certified by the HMO covering the specific patient that they want to see, they won't be able to actually get paid for that practice. It's well and good to be licensed. What are there states that have adopted any willing provider certification policies? That's something that I've been looking at over the last several years, and am intrigued by that as an avenue to pursue.
Sure. Thank you, Mr. Chair. Great question. My colleague in the health program, Emily Blanford, is our Medicaid expert, and she covers any willing provider laws and regulations. So I'm going to take this question to her and have her send you some information that you can also share as well to the committee.
Okay, will do. Very good. Thank you. Committee, I just wanted to mention one other thing, and that is that I know that, I'm not sure if she's on, I didn't check. Representative Day Hockman V. Hill has been working on specifically to behavioral health counseling, social workers, and psychologists, and drug and alcohol addiction specialists. Some kind of streamlined or total reciprocity or something akin to what Kentucky, it sounds like Kentucky did on, but she would be basically on the behavioral health issue. And this is a topic that I think we're really keen on, because so many of our rural communities have difficulty getting behavioral health provision. Even with telemedicine now, it's a dilemma. But with all of that, any other questions? Any other comments from anyone? I want to thank you. Is somebody getting on?
Well, Mr. Chair, I just wanted to quickly respond to your comment on at least streamlining. You know, we have done a lot of research recently around addiction counselors and credentialing addiction counselors because it's different in every state. Some, you know, and big shout out to Zach who helped me look at some of these too about how do we, some states have certifications for addiction counselors. Some states have licensure for addiction counselors, and you know, a certification in one state can also equal a license in another state. Like there's just no uniform credentialing or licensure process for addiction counselors. And so we've been looking at states trying to streamline, at least for that profession, where maybe they're not, it's not an actual license, it's just a certification. Like a licensed professional counselor can go get who's licensed and they bill under their licensed professional counselor license, but they can go get a certification in addiction counseling. And then there's some states who actually do have a separate license for an addiction counselor. And so it causes a lot of confusion. And we see that a lot with providers who don't necessarily have national organizations like community health workers, peer support specialists. You know, the licensing and certification is really all over the place. And so states really, I think, do struggle to figure out how do we streamline these providers? How do we create licensure? How do we create certification? So it is something that we track. I manage a website called scopeofpracticepolicy.org, and the link is in the slides. And we track scope of practice regulations for addiction counselors, peer support specialists, and then a variety of other providers as well. So it is a great resource, and it's something we're actively tracking. So if you all have questions related to that, please reach out. We'd be happy to help.
That's good. That's really good. I know I sat in on one of Representative Hockman Behill's work sessions, and it came up that in New Mexico we're facing this. All these different labels for different, not even different fields, but different levels of training in the same field. Addiction, what do they call LADACs, licensed alcohol and drug abuse counselors, and even counselors themselves. Apparently in New Mexico, we have 12 different or 13 different counseling licenses. So it's an incredibly complex area, and any help you can give us, I appreciate your referring us to that website. Well, thank you very much, Sydney and Iris and Zach for your input today. It's been very helpful, very useful information. And members, we'll go now to the next item on our agenda. If John Blair and Linda Trujillo are here, we're ready to move on to healthcare professional licensing issues in New Mexico.
Good morning, Mr. Chairman and Madam Chair, members of the committee. It's really a pleasure to be here this morning. I do have with me John Blair, who is the director for the boards and commissions. John and I started on the same day, so we've been learning together a number of things. I will say that I was at the boards and commissions division under the Richards administration for 5 years, and was in John's shoes for a couple of years. So we've been great partners on this. I am very sad to say that the superintendent is unable to attend today due to some personal conflicts, but she sends her regards to the committee and has entrusted John and I to present the information. I do believe that we have a presentation.
Okay, I just want to comment that it's John Blair is a familiar face for those of us who watch television commercials, so very good. And welcome former Representative Linda Trujillo. It's good to see you in a new role, and we're looking forward to your presentation, so go ahead.
Thank you, Mr. Chairman. I'm not sure how to get it up onto the screen. Do you all have it?
Not yet, but Nancy will probably be able to help you.
Okay, it says I'm now the presenter. I am sorry, Mr. Chairman. I am just unfamiliar with this technology. So maybe I should just begin the process.
Well, let's see. Let's see. Nancy will help you.
Would you like me to share my screen, or are you?
Yes,
do you
please.
want? Okay,
Yes,
hang on one
yes.
second.
Thank you. This is one of the new things I think that we've all been trying to figure out.
Yeah.
Well, there we go. Perfect. Thank you. And you'll have to change the screens, is that correct? There we go. Let's move on to the mission. So the mission of the Regulation and Licensing Department, I'm the current deputy. As I mentioned, John is the division director for the boards and commissions. Our mission is to ensure that New Mexicans receive quality care and services from qualified professionals. And I know the question was asked earlier, what's the purpose of licensing? And this is the purpose that we live every day, is to ensure that there is quality care and that the services are provided by qualified individuals. So whether you're visiting a dentist, going to get your hair cut, getting an eye exam, you've probably taken for granted those individuals have been screened and are professional and have the qualifications. But that's the job that we do every day. We license more than 35 different industries, professions, and trades, and we touch almost everything. So nearly everyone in this state is probably touched by a professional that we license, certify, regulate, and oversee. So I want to move on to the next screen. Has the specific divisions that the department is responsible for. We've got the Alcoholic Beverage Control Division, which oversees the Liquor Control Act, administers the Alcohol Server Training Program, and I lost my train of thought on the end of that sentence, so I apologize. I had to fix it last night. They also oversee the New Tobacco Products Act. And those rules are in process at this point, are not effective until January 2021. But Director Andy Viejo gave me an update last night, and they are in process of getting those rules drafted. John oversees the Boards and Commissions Division, which has more than 30 different professions and trades, from accounting to funeral services. The construction industries, of course, oversees the building trades, contractors, mechanics, electrical, mechanical, LP gas. We conduct field inspections. Construction industries is the one division that the department has actually opened up to the public. The rest of the department is working remotely, and construction industries is open for contractors and individuals to bring in their information for permits on a daily basis. The Financial Institutions Division is overseen, and that includes the regulation of state chartered banks, savings and loans and credit unions, trust companies, collection agencies, endowed care cemeteries, small loans and motor vehicle finance companies, mortgage lenders, and loan brokers. And finally, we've got the Securities Division, which licenses broker deals, financial advisors, and other investment professionals. So we have a huge range of professions that you can see we are responsible for. I want to point out that today John and I are not going to address improving customer service, although I want to just assure you that it is in fact at the top of our list, and we're working on some areas to improve our phones, to ensure that everyone gets responded to in a timely manner. And we're also not going to address technology updates, which are critical to improving the customer service that we perform here at the Regulation and Licensing Department. So the reason we're here presenting in front of this committee, you could turn to the next page, please, is because of the health practitioner boards that we oversee. Now, this is a list of the health practitioners that are actually part of the Boards and Commissions division that John oversees. And I know it was already stated, but in New Mexico, we actually have 3 different kinds of licensing boards. We've got the independent boards, as Chairman Armstrong mentioned, such as the nursing board and the medical board. And then we've got the administratively attached boards, similar to counseling, chiropractic, dental health, doctors of osteopath. And then we actually have boards that are advisory in nature, and we'll cover that a little bit later. So we do have the 3 different models in New Mexico, and at RLD, we actually have 2 of those models. So the next screen is actually the number of licensees for each of these health practitioner licensing. And I would just point out that we've got some really, really small boards with very few professionals licensed, which, as you can imagine, budgetarily makes it very difficult to provide a full scope of services for those boards because the funding is not there. Athletic trainers, 184. Chiropractic is just under 600. Nutrition and dietetics is under 500. Optometry is under 300. And then podiatry, which is under 150. And there was a question asked earlier about kind of the scope of practice and whether individuals could provide services that are really in short supply and necessary during COVID. And I will just point out a story that was relayed to me, and that is that the podiatrists were interested in helping with testing, COVID testing, and their scope of practice only allows them to do feet. And so although they are highly trained medical professionals, they were limited by their licensure to providing feet services. And of course, we don't have a COVID test that we can do on our feet as of yet. Let's hope that something comes. If you could move on to the next. So one of the questions that came up in talking with Madam Chair was the Sunset Act. And here's a list of the current professions that are under sunset review. And there's quite an extensive process for that. And coincidentally, or maybe this was planned, most of the health professions you'll see are listed on this Sunset Act and actually expire at the same time. So we're having an LFC hearing in October. We've already submitted a fairly substantial report on each of these licensing boards to the LFC in regards to some of the questions that are required to be answered. In other words, under the Act, the Sunset Act, has the board permitted qualified applicants to serve the public? Are they operating in the public's best interest? Are there any recommended statutory changes? Is the industry working to resolve problems? Is the public involved in issues that come up? And is there a reasonable and effective complaint process in which complaints are managed and responded to in a timely fashion? So those are just some of the questions that we had to ask. John, is there anything you'd like to add to that particular in regards to the reports?
Not right now. Thank you, Linda.
Okay. Let's move on to the next screen. So this is our general reciprocity language in the Uniform Licensing Act that has to do with expedited licensure. And this particular piece of the Uniform Licensing Act is in fact applicable to the healthcare professions. I will point out, and I underlined it, that although it really is titled expedited licensure, an individual still has to provide all of the information. In other words, they still have to provide a full application and all of the required fees and all of the information that's required of that board. And as soon as they do that, then we're to license them as soon as practical. John is going to talk a little bit about this. Go ahead, John.
Yeah. Thank you, Madam Deputy. Mr. Chairman, members of the committee, right now, as I understand it from our team, we are working under a process where these licenses are being expedited within about 3 to 5 days of receipt of all of the materials. And that in many cases is what slows down the process, and in many cases is what results in you hearing from constituents is sometimes there's some confusion about what materials are due to complete the various licenses. But feel like we are working very quickly to ensure these licenses are processed as fast as they can be. And then we will be working on trying to implement some rulemakings with various boards to ensure they all have provided the authority for us to have these licenses be processed as quickly as possible.
Okay, can we move on to the next screen, please? So this is another expedited licensure piece that is also included in the Uniform Licensing Act. And again, I just underlined those pieces that I think are important for the legislature to, Mr. Chairman, Madam Chair, members of the committee, I'm sorry. It's important for these things to be noticed, and that is that you still have to file an application and you still have to provide all the documentation that's required for the application. And in many instances, that can be very complicated and not nearly as timely as we would like to see that happen. And we're going to talk about some of those barriers as we move on in the presentation. John?
Yeah, thank you, Madam Deputy. Mr. Chairman, members of the committee, prior to the Deputy Superintendent and I joining Regulation Licensing Division, members of my team had been looking at multiple options in which to help promulgate the law that was passed this last year. Initially, one rule was considered for the entire department, to ensure the expedited processing for these military licenses. There were some concerns expressed about the fact that each individual board has its own legislative authority and the need to ensure that those rules are promulgated under each individual authority. And so we're beginning the process now to expedite as these boards and commissions can have their next rulemakings, to have them include language that provides for this expedited processing. At the current time, I am aware of 2 license applications that are going through our private investigator board that would fall into this category. And we are working with those 2 individuals to ensure that we have all the materials available so that they can be processed as quickly as possible once that is complete.
Okay, let's move on to the next screen, Mr. Chairman. Madam Chair, members of the committee. So we wanted to point out today those models, keeping in mind that there are different models and it can cause barriers. The legislature certainly in its wisdom made the determination that it's important that the professionals in the field are overseeing the rules, the standards for licensure, and the disciplinary actions, all of that stuff in the legislature's wisdom was delegated to those boards. However, there are some challenges that we would just like to point out. Here is an example. Under the Osteopathic Medicine Act, You see in the board is created, and there's this little sentence that says the board shall be administratively attached to the regulation and licensing department. Unfortunately, there's no definition in that act as to what administratively attached means. So it goes on to tell what the board's responsibilities are, which is to issue licenses, to discipline, to protect the public from unauthorized practice of osteopathy, to enforce and administer the provisions of the act, to adopt and promulgate rules in accordance with the ULA and the State Rules Act. So the board has all of those authorities, but again, there's really no definition of what administratively attached to RLD means. And there are times when that can be a little problematic. We could move on to the next screen. I want to show you an example of, Mr. Chairman, Madam Chair, members of the committee, of a board that actually has the definitions of what the department does. So here we see that the board is created and that the board is administratively attached to the department, but it's really clear the definition of what administratively attached means because it spells out our duties. We're to process applications. We're to conduct and review the required examinations. We're to issue licenses and certificates of registrations to applicants who meet the Counseling and Therapy Practice Act. We're to administer, coordinate, and enforce the provisions of the Counseling and Therapy Act and investigate persons engaged in practices that may violate the provisions of the Act. I'll note that we don't have the authority to take disciplinary action. That's going to be the board's authority, but we do have the authority to take in the complaints, do the investigations, and provide that information to the board. We have the authority to approve the selection of primary staff that's assigned to the board. And although that may seem like a small thing, it's really an incredibly important aspect of what the regulation and licensing does. We're to maintain records, including financial records, which is of course required of any state agency. But this defines that the department is the one who's to maintain those. And then to maintain a current registry of licensees and registrants as a matter of public record. So if we go on to the next screen, you'll see that if we could go to the next screen, there we go. The counseling board actually maintains all of the authority related to the actual profession. In other words, the practice of counseling and therapy. They have the ability to adopt, in accordance with the ULA and the State Rules Act, the rules necessary to carry out the act. They select the examination for licensure. They're responsible for determining the passing scores for the examination. Here they are the ones who take the disciplinary action based upon the information that the department provides. They have the authority to censure, to reprimand, or to place a licensee or registrant on probation. They get to determine the criteria for continuing education, and they get to establish rules for the procedures for how to receive, investigate, and resolve complaints. So they help guide the department in how we do that job. They also have the responsibility to determine the types of supervision and postgraduate experience that's required for people who are seeking licensure. And then they have the ability to determine the eligibility of individuals for that licensure. Now, I don't have a screen for this, but I just want to point out those are very distinct and very different types of administratively attached. One being incredibly undefined and the other being really defined so that we each know what our responsibilities are. We also have advisory boards. And in the medical profession, we have the Respiratory Advisory Board. Those board members, unlike these other boards who are appointed by the governor, those boards are appointed by the superintendent. The superintendent also, in consultation with the board, has the authority to promulgate the rules and to take disciplinary action. So very different than a board that maintains nearly full authority for the implementation of their act. So next I want to talk about, just briefly, kind of an oversight, because I'm sure there's going to be questions. John and I have both been listening in, and so we're aware of the questions in regards to the national compacts. I will say that a national compact is very different than reciprocity. And with reciprocity, there's not that requirement to take the all of the standards that are required under a compact. With reciprocity, the board has authority, or if it's an advisory board, the department has authority to determine what that reciprocity would look like. The physical therapists have indicated to us that they're interested in pursuing a compact, the ability to enter into a compact. This is information that came directly from the Physical Therapy Compact website, and their goal is to increase mobility of eligible physical therapists. And again, I think it was already mentioned that this is not for initial licensure, so you have to be initially licensed in a jurisdiction. This is for you to get licensure, the ability to practice in another state. The Physical Therapy Compact also has a commission, and the commission is the governing body that oversees that. And if a state becomes a member of the compact, then they appoint an individual to serve on the commission and be part of that compact commission. I couldn't figure out how to get the map onto the screen, and so I did put the website link there. But I will just point out that all of the states surrounding New Mexico currently have adopted the compact. Arizona, Utah, Colorado, Oklahoma, and Texas have already implemented that. So if anybody's interested, that link will get you to the map of the states around the country that have adopted the compact. If we could move on to the next screen. We're also aware that the counseling profession may be interested in a compact. The counseling has talked to us about a couple of things that they might be interested in. One is we're understanding that art therapists are not covered by insurance. And so we're still exploring the issues surrounding that. We've asked them to help us get some information about how we might move forward on getting that particular licensure approved for insurance reimbursement. But again, you know, you'll see in the second paragraph there, they're really clear that in order to become a reality, this compact has to first be adopted by either individual state licensing boards. In our case, we believe that it requires action by the legislature. We don't believe that the board has the authority to enter into a compact without legislative approval for that. We can move to the next one. And Mr. Chairman, you've already mentioned that the psychology compact was considered and didn't make it through. This one is a little more complicated in that if you want to do telepsychology, you actually have to obtain an e-passport certificate from the Association of State Psychologists, in addition to being part of a national compact. So that one was a little more complicated and difficult to figure out. We'll continue to do some investigation into that to see whether or not it's something that you know, we would put forward in the future. Then on the next page, you'll see a list of the states who have already entered into the psychology SIPAC. Again, Arizona, Colorado, Nevada, Oklahoma, Texas, and Utah, states that surround us, have already entered into that. There's also some states that have entered into it but haven't begun the implementation process. This is among national compacts, is one of the newer compacts. And so it really has, you see by the dates there, that it ranges from 2016, which really was only 4 years ago, up to a number of states that actually just enacted that legislation this year, and it won't be effective until January or March of this coming year. So the other thing that we are understood was of interest to the committee was telehealth and telebehavioral health. And this was really outside of the scope of what we do at RLD. And so we don't have a lot of information. We did meet with Neil Bowen from Health HSD and with Jane Wishner from the governor's office to kind of get some insight into the issues surrounding telehealth. This was a slide that was provided to us. We learned that UNM is doing some research right now to determine whether or not telehealth, telepsychology, or behavioral health is effective and the quality of it. At this point, it's our understanding that it's looking promising in that there's increased access. The no-shows dropped because travel and time is not an issue. An individual could go into their car. They don't have to leave work, those things. But just even based upon what we see in this committee, I will point out that if this is a solution for rural health, for rural communities, there still is going to be an internet access problem. And so that has to be addressed simultaneously in order for it to expand to communities. That's really about the extent. Oh, I know there was one other thing that they mentioned to us, that there has been some concerns about HIPAA compliance. Apparently the federal government has decided and stated that they're not going to investigate HIPAA violations at this point. There's not a lot of security in that because it's just a statement. It hasn't been a rule change. There hasn't been a statutory change. But the federal government has indicated that they will not be investigating those issues at this time. So that takes us on to a framework for licensing reform. And I just want to point out a book, a report that's been really helpful. I appreciated it when it came out in 2015. And in my job right now, I have appreciated it even more. And that's a report called the Occupational Licensing, a Framework for Policymakers, that was issued by the Obama administration. And there's a couple pieces in there that we at the Regulation Licensing Department are really focusing our attention on. There's a list here of 5 things that licensing reform will help reform licensing, make it more efficient, and make it only necessary, only useful when it's, or used when it's necessary. We want to make sure that substantive requirements of licensing are closely tied to public health and safety concerns. And that goes back to ensuring that if a license is required or a registration is required, that the experience and the education requirements are tied specifically to public health and safety concerns. The next thing is that we want to minimize the procedural burdens for acquiring a license in terms of fees, the complexity of the requirements, processing time, and paperwork. And this is really a high priority for us because we still have paper applications coming into the department we still have checks coming into the department. I received a call yesterday from an individual for a non-healthcare board that was trying to get licensed through the engineering board, and the requirement is that you send in a check that has an address on it. And this individual has recently moved and wanted to know if his check would still be accepted. And I contacted the engineering board and learned that what he needed to do was cross out his address on the check and write in his new address. I don't pay very many things, and I imagine, Mr. Chairman, Madam Chair, and members of the committee, that you too rely pretty highly on digital payment methods. We do have a checkbook in my house that we pull out. It's in the safe when we need it, but it honestly doesn't get used very often. And so we have got to move away from that as a department, because there really are some barriers there. And the last thing that I want to point out that we're really committed to working on is reviewing the licensing requirements for formerly incarcerated individuals, for immigrants and veterans, to ensure that the licensing laws do not prevent qualified individuals from securing employment, while it still provides appropriate protection for consumers. Those are the three priorities that we're focusing our attention on. Let's go ahead and go to the next screen. So these are the three things that they say that you should do. Number one is to carry out this comprehensive cost-benefit assessment of licensing laws through a sunrise or a regular sunset review. New Mexico has both of those. We have a Sunrise Act and we have a Sunset Review. And the Sunset Review is really pretty comprehensive. Facilitate a careful consideration of the licensures, costs, and benefits. This is a little more problematic. We don't really have economic analysis of what really are the licensure costs and benefits. And one of the things that you probably are aware of that has been an ongoing problem is that individual boards really build up some pretty high reserve funds. And in times like this, those funds get swept. And what we'd like to do is look at ways as to how we can use those dollars and leverage the benefit for things like ensuring our telephone systems are up to date, ensuring that we have a functioning licensing program that provides all of those, updated benefits for online application and online payments. And then the last thing is to work to reduce licensing barriers. And that is an action that we believe is more fitted for the legislature to provide assistance with. And I would just say, I put that little picture on there because I truly believe if you change nothing, nothing will change. And change is just a part of life. It's something that we need to do. It's not easy to do. Some of the things that the report points out is that it's important that change for licensure reform is not politically motivated, but is really motivated on the cost and benefit analysis and the health and safety of the public. So on the next screen, I've got two photos, maps, charts that I was able to get from that report and put onto this screen. And you'll see that the second one, the one to your, if you're looking at it, the one to your right, New Mexico is not at the top of the list, but we're pretty high up there in the requirements for education and experience. We require a tremendous amount of education and experience for professional licensing. The one that's on the left side of the screen is in regards to the number of professions that we license. And we're also very high up there in the number per capita of professions that we license. It shows that about 1 in 4 people that work in New Mexico have to be licensed by some sort of with some sort of professional licensing. And that is the end of our presentation formally. John, did you have anything you wanted to add?
No, but happy to answer any questions that the committee has.
With that, Mr. Chairman, Madam Chair, we stand for questions.
Well, thank you very much, both of you, and it's a good kicking off point, launching pad for questions, and we have a couple already. Representative Thompson, let's start with you. Then each of the other questions are from Representatives Armstrong, Gail, and Debbie. So let's start with Representative Thompson.
Thank you, Mr. Chair. And I have to say, Linda, it's great to see you. We miss you. So the first thing I want to talk about is, I've lost all track of time. So a year or two ago, I went to Washington, D.C. to sit in on a 2-day conference on a compact for speech and language pathologists and audiologists. So I'm just throwing it out there that I'm working with them on doing language for that compact. So just a heads up there.
Thank you.
And then I'm wondering, I got an email from a constituent regarding the chiropractic board, and he sent me a string of emails, and they kept canceling their meetings. And so he had actually bought a practice here and got here and was unable to get his license for several months because they weren't meeting. Can you talk a little bit about what happened with the boards during, well, I mean, did they shut down? Did people, and I know probably each one varies, but can you talk a little bit about how the emergency affected the meetings of the boards?
John, do you want to talk a little bit about that? I mean,
Sure.
Our staff, Madam Chair, Mr. Chairman, members of the committee, Representative Thompson, our staff went to remote working, but they continued to provide the services as if we were here. There have been some hiccups on that, and John and I are working really closely and diligently to try to resolve some of those. In regards to the board's meeting, none of that, generally speaking, I can't speak, I'll let John speak directly to the chiropractic if he can. Generally speaking, the boards went to the same processes that we're using right now today, which is approved by the Attorney General's office. And for the most part, we're using WebEx for those. John?
Thank you, Mr. Chairman, Madam Vice Chairman, Representative Thompson. Nice to see you. As I understand it, I can't speak to the specific of the chiropractic board. I'm happy to reach out to my team and find out and follow up with an answer for you about that. What I can say to the Deputy Superintendent's point is that our team and the various boards and commissions are continuing to provide all the various public notices, all the various compliance with the ULA, with the State Rules Act, with the Open Meetings Act. It's now just all being done in a digital format. And so if the board wasn't able to meet, that was prior to my time with the division, my guess would be that there were concerns around having a quorum to meet, would be my guess. But like I said, I'm happy to investigate and follow up with you directly.
Okay, thank you for that. And then just, I guess, this is maybe a piece of advice that, and I did contact the staff regarding that board, and it was nearly a week before they got back to me via email or phone. So, I understand that people get backed up. I think it would make everyone feel better if when you call in and leave a message, if it's going to be 2 weeks before you call, have your message say that, due to high volumes, it may be up to 14 days before you, because, it's like, okay, well, it's been 3 days. And so you call again and you just get more and more frustrated. So I think people are much more likely to give you a break if you're honest with them. as opposed to, "Oh, I'll get right back to you," and then the time goes on and you get angrier and angrier. So I think just trying to be as honest and open as possible. And the guy dealt with, the chiropractor, was quite patient, but I could see that, and I know that people are scrambling, and just be honest with the public, and people will give you a lot more of a break. So thank you for what you all are doing, and I'm sure you'll be hearing from me again.
Mr. Chairman, Madam Chairman, Representative Thomas, if I can respond to that. In the short time in which the Deputy Superintendent and I have been at boards and commissions, what we've been trying to institute with our team is the fierce urgency of each request that comes in. That it's not uncommon for a staffer at any level of government to, if they're processing thousands of licenses a week, it may start to feel redundant or repetitive. But we've really talked with the team about the fact that when someone has submitted a license for approval, it is likely their livelihood, it is all they're thinking about and focused on, and the great urgency in providing swift, effective customer service back to the community so that people get the sort of care that they need. And so we are working to turn that ship around to provide that level of customer service.
That's very appreciated. Thank you so much.
Let's go next to Representative Gail Armstrong, and she'll be followed by Senator Nancy Rodriguez.
Thank you, Mr. Chairman, and thank you for the presentation. And I too miss you, Linda. Glad to see that you'll still be hanging around. One of the questions I had is there, it seems to me like there is RLD's licensing procedure, and then there's additional procedures tapped on with board and commissions. Is that correct?
Mr. Chairman, Madam Chair, Representative Armstrong, members of the committee, no, that is not. So what there is there's regulations, rules that are, if the board is an independent, administratively attached, right? If they're administratively attached, they develop all of their own rules. We implement those rules administratively. We provide HR, technology, finance. We provide the building. Those kinds of things are what we provide. But we don't adopt rules unless it's an advisory board. So in the case of the Private Investigations Board and the Respiratory Care Board, those are advisory boards. And the department has the authority, responsibility to adopt rules in consultation with those boards. But there's not two sets of rules, procedures that people have to follow.
Okay, thank you, Mr. Chairman, and thank you, Deputy Secretary. So as far as like counselors, the issue that I keep beating the dead horse about, one of the issues is that New Mexico requires 5 years to have a license in another state. They have to have it for 5 years. And in the expedited license, how does that coincide with the expedited license? If they don't have the 5 years experience, do they go for the expedited and then they get kicked back after that? Or how does that work, if you know?
Madam Chair, Mr. Chairman, Representative Armstrong, under the expedited licensure, the individual who's licensed in another state has to have substantially the same training, experience, and education that's required in New Mexico. And so again, the challenge, barrier, or positive side, I don't want to make a judgment call about it, is that those decisions are made by the board. So the board is the body authorized by the legislature to exclusively make those determinations.
Okay, thank you. That's helpful. Yes, that's helpful. Thank you, Mr. Chair and Deputy Secretary. But you know, this is part of, and I know you recognize this, but this is part of the barrier that's in place for the counselors to even try to get their license here, because they have had their license in another state for 3 years. We require 5 years, so they cannot even get in front of the board to show them all of their 25 years of experience. And so I just wanted to bring that to your attention. I finally, during my last comment, I got a text from Victor saying that he's going to get us all together and try to figure out how we can expedite this. And in an email, he put everybody together. So I appreciate that, and I'm happy that you're there. Really happy, Linda, for you, and praying for your family, that all is well in your world. Thank you, Mr. Chairman.
Mr. Chairman, Madam Chair, may I respond?
Yes, absolutely, please.
Thank you, Representative. I truly appreciate it, and I just miss you guys tremendously. I'm going to try hard not to cry. I have my fan going so that I can keep my emotions under control. But we have been meeting and talking about your letter and trying to do some research to kind of figure out, like, what are the barriers and what might be our options for that. We have spoken with Representative Day Hockman-Vigil in regards to her work. I wasn't aware of Representative Thompson's work on the speech language pathology. We're also, kind of trying to figure out exactly what the priorities for this upcoming session are going to be. At this point, we don't necessarily have all of those priorities. And John and I really have hit the ground running. And it is, in fact, our goal to focus on those 3 things that I pointed out. So thank you for your letter, and thank you for your patience.
Thank you.
Thank you, Representative Armstrong. Senator Rodriguez, followed by Senator Cedillo Lopez.
Thank you, Mr. Chairman, and thank you, Linda and John, for your presentation and your great work. I think you're making us cry too. So the only difference is that I don't have a fan behind me either. I want to thank you also for your many years, and not only while you were representative, but prior to that, you've given us in the state so much of your talent, your experience, and your great mind. Just incessant work. Thank you very much. And of course to John Blair also. I just wanted to say that I have learned so much today. I did not know that you and we, the state, have 425,000 individuals and businesses that you regulate, and not only regulate, but you license. And I can fully understand when you said you don't have the resources. Well, that's a lot of work and a lot of licenses. And to keep up with the regulation is just too much, and especially without the resources. So we have some work to do, Linda, to see what we can do. I know that funding is very short, and so on with this COVID and the impacts on the economy and so on. But if we want to continue to have these businesses, run in a robust fashion, and we continue to regulate, and we need to prioritize this funding for you to be able to do your work. So I just want to thank you very much. You've answered my question about the independent boards. You indicated earlier that you don't set the rules for them, but you do provide peripheral support of other kinds. And so that's what I had asked. I was going to ask, but you've answered it. Thank you. Thank you very much, Mr. Chairman. And thank you, Linda and John.
Thank you, Senator Rodriguez. Senator Cedillo Lopez, to be followed by Representative Tara Lujan.
Thank you, Mr. Chair. And thank you for that presentation. It was good to see both of you. I just have a couple of questions, and I apologize, this is very basic. What are the consequences in the state of not being licensed?
Mr. Chairman, Madam Chair, Senator Cedillo Lopez, members of the committee, it depends upon the board. And so there's for the health professional boards that we've been discussing today, the consequences are that they can be sanctioned. Under some boards, there's a fine that can be levied. There may be criminal penalties. I would need to kind of look at each individual licensing act that we're responsible for. I can do that and respond to you at a later time. But there are also boards such as the Interior Design Board, which is not a health and safety issue, but they are a board where you don't have to be licensed in order to practice. You have to be licensed in order to call yourself a licensed interior designer. And so it really depends upon the practice, the authorizing act, what the punishment, if any, of functioning unlicensed in the state of New Mexico.
Oh, just a follow-up to that. So why would we care about interior designers being licensed under the state if there's no
Mr. Chairman,
consequence?
Madam Chair, Senator, I don't have an answer for that. I don't.
And I apologize. It's actually outside the scope of your presentation. It just popped into my head. That's kind of weird. And then because I was thinking about athletic trainers and nutritionists, I've used both, in Weight Watchers or whatever, and I was not aware at all that I could be using an unlicensed or a licensed person. I don't recall ever seeing, so I probably used unlicensed people. I don't know. So again, why would we care? How do we protect the public by licensing nutritionists if they could, like Weight Watchers, I don't think has a state license, but they have, I don't know, what are we doing licensing them?
Mr. Chairman, Madam Chair, Senator, in regards to the athletic trainers, those individuals actually are implementing a doctor's order. So in many cases, so if you're, say, an athletic trainer working with a sports team, and you have an individual on the team who has been injured, the doctor and or physical therapist are probably not going to be right there on the field or even at practice. The athletic trainer is. The athletic trainer is the firsthand provider for that. I'm not familiar with what they do in a gym or such, or whether those are just personal trainers, which I think is different than an athletic trainer. Okay.
Yes. Okay, I got it. I probably have never had an athletic trainer then.
And the same with a nutritionist. They will advise on diet, i.e. someone who's diabetic, pre-diabetic, who has an illness or is looking to lose some weight. They will typically work in a doctor's office or a medical facility and actually provide medical direction. And so they do have training in order to do that. And I think part of it is the reimbursement by the insurance company to provide those services, rather than Weight Watchers, who is probably just advising and an employee of Weight Watchers, and there's no insurance reimbursement.
That makes a lot of sense. So that raises the issue to me about the art therapist. You said that they could not get insurance. When I was at Enlace Comunitario, I tried to hire an art therapist out of New York City. And this person had all kinds of experience, had the highest level of licensure that you can get in New York City, but she had such a difficult time here. We ultimately ended up, it was such a time problem that she ended up getting another job in New York and not coming, which I thought was a big loss. And so is there a specific problem that we could address with that? Because especially with children who are in domestic violence situations, art therapists, the studies have shown they're very effective. And so I just got frustrated with that. And if there's a legislative fix, or is that a fix within the agency?
Mr. Chairman, Madam Chair, Senator, that is something that was brought to John and I's attention very recently. And we have not been able to identify exactly what the issue is. The way it was presented to us, though, is that it is an insurance issue. Whether that requires a legislative fix, I'm not certain about that. But we will continue to look into that and can respond to you when we get that information.
On that point, if it is a legislative fix, I'd like to see what that is, because it is a big loss. It hurts our people not to be able to bring them. And then finally, and I'm not sure this would be you or the boards, I guess, because I haven't looked into this more deeply. But my final question is, I had massage therapists who live in my district ask me, and I didn't know, now I know to contact you for the answer, but they said that the CLE not the CLE, the continuing education requirements require in-person training, and that now with COVID, there's very little that they can do in person. And so they were very frustrated about whether they were going to lose their license or what. And I told them I would look into it. So it's very convenient that I'm speaking to you now.
John, I'm going to let you respond to that.
Yeah, Mr. Chairman, Madam Vice Chairman, Senator Cedillo Lopez, nice to see you. I know that we have had at least one meeting with Higher Ed Board about new licensees for massage and actually for barber and cosmetology that still require some in-person training. My understanding is that for most therapists who have already been licensed before, what many of the boards have done has been to allow a lax period where they don't have to meet those continuing education requirements until a certain period of time after the governor's public health order is no longer in place. And so I know that there are some problems with new licensees who are applying for the first time and their difficulty in getting that continuing education. But that is something that the individual board or commission would have to modify their own rules to allow for that. That's not something that the superintendent or the deputy or myself could do, but I'm happy to talk with you offline so that we can reach out to this constituent of yours directly and try to help them resolve the problem.
Yeah, my understanding is that they have not received, that they're expecting any time to receive notice that it's okay to do online, but they haven't. And I guess their expiration is at the end of the year, so they're just getting a little nervous.
Okay.
Will make, and we don't have a recommendation for one way or the other because there really are positives and challenges in either one.
Okay, I'm looking forward to understanding that a little bit better because, like I said, if our responsibility is to protect the public, that's a huge barrier for me. Thank you. Thank you, Mr. Chair.
Thank you, Senator. Representative Debbie Armstrong, did you have something on that point you wanted to bring up about art therapy?
I can wait until I've got several, so I'll can just make some clarifying remarks when it's my turn to ask questions.
Okay, thanks. Great. So we still have Representatives Tara Lujan and Ferrari, Joanne Ferrari are still on the list. So Representative Lujan, you're next.
Hi, thank you. And I just want to say just a giant thank you to Linda Trujillo for all the work and everything you've done. And I'm fortunate to fill your seat now. And I just want to say what an honor it is. And to have worked with you and just have known you and all the things that you've done for us. And I just want to say thank you. And also to John Blair, you've really helped us here in New Mexico, both of you, and I'm glad to see you still doing the work that you're doing there at RLD. I'll just ask my quick question, and I just want to ask if you are familiar with the Emergency Powers Code, which I'm sure you are. It was enacted in 2005 that put together our emergency power statutes. And those would be the Emergency Licensing Act that was enacted in 2002 after 9/11. And I just want to know, have we had to use the Emergency Licensing Act now during COVID?
Mr. Chairman, Madam Vice Chair, Representative Lujan, members of the committee, thank you. Thank you. I appreciate your kind words. I'm honored to have you working on behalf of Santa Fe, and I just want to thank you for to step up and do this really heavy lifting. In regards to the emergency licensing, that is an issue that we believe the act may have some barriers to it. We have not used it at this point in regards to COVID and the professions that we license at the Regulation and Licensing Department, but we are exploring what that might mean in regards to the continued pandemic and state response to that.
Wonderful. Thank you for that. That's something that I've been looking into myself, and I appreciate it. And again, just world of thanks to you, Linda, and to John as well. Thank you, and I look forward to working with you on many more things. Have a wonderful day.
Thank you.
Thank you, Representative. Representative Ferrari, you're up.
Thank you, Mr. Chair and Madam Chair. And hello, Director Trujillo. It's so nice to see you. And also, I have a kind of a similar question as Senator Cedillo Lopez had regarding the extension or the certification. And this isn't exactly for healthcare providers, but for water safety. One of my constituents is a trainer for the New Mexico water and wastewater operators. And a lot of them are coming up with their certification lapsing because they can't do online. They are still very much entrenched with in-person training. And so they were concerned, you know, that we would not have licensed or certified wastewater treatment people to keep our water safe and to be able to inspect and do all the things that they need to do. And John, I'm not sure if this is still your question, but would their certifications also be extended, or some kind of because of COVID, some kind of exception be made?
Madam Chair, Mr. Chairman and Madam Chair, Representative Ferrari, again, I don't know specifically what their regulatory board has done with regard to their CEs, but I'm happy to investigate and follow up with you directly about that question.
Great. I really appreciate that, because I think that would be something that would be critical to our state and all of our municipalities. So, okay, thank you very much. And hi, Linda. Thank you, Mr. Chair. That's all.
Thank you, Representative Ferrari. And finally, then, Representative Armstrong, Debbie Armstrong.
Thank you, Mr. Chair, and thank you, Linda and John. Linda and I go back to her first stint at Regulation and Licensing. So thank you for the job that you're doing there. Glad to see you there, and same with you, John. It's good to see you, and glad to know you landed there, because I think we need help. So, and I learned a huge a bit of information this morning from you, and that is, I assumed that all of the boards and commissions under the Regulation and Licensing, that you had a bit more authority over them, and you don't. So that's hugely helpful, because it highlights my earlier comment about this is kind of messy. And so for something like dealing with an emergency and just adjusting the continuing ed, if that's, which we've brought up here, if that's the only thing we were looking at, that's each and every board has to have the emergency authority, correct?
Mr. Chairman, Madam Vice Chair, that is correct.
Yeah.
And it is really messy. You're absolutely right. And I miss that our offices are not right next to each other.
Yeah. So I'm wondering, and I'm not very familiar with the Emergency Act previously, but I know that it can't be used to the extent that we wish it could. It's these exact barriers that we've been running up against. Could it be modified? Could there be an ability to, whether it's from the governor's office or boards and commission, regulation and licensing, supersede those boards in an emergency for things like continuing ed or in-person training or whatever it is, expedited licensure, that didn't require each and every one of those boards? And could that also, in that context, if it could for that, could it also include some of the independent boards, or is that even more difficult to have an emergency authority? I know some, like the pharmacy board, has done some emergency, I think it was the pharmacy board, some emergency authority in their regulations. But that's a huge job if we have to do emergency authority in each and every board, just in healthcare, but let alone everything else. So I'm wondering if you have thought about if there is an overriding ability, even if it just for emergency purposes, to be able to do something a little bit more sweeping.
Thank you, Mr. Chair, Madam Vice Chair. So it is messy. There's just no doubt it's messy. And I'll just go back to the third slide that we shared, and it's messy because there's multiple boards with multiple authority, and because there's at least more than 425,000 people who are impacted by that.
Mm-hmm.
And so that adds to the messiness of, changing something. I think we're all aware of what happens when we try to change something and hundreds of people show up because they're not happy about it. We have presented and are still in discussion with what some of those solutions might look like. I wish I could give you a little more kind of meat to that right now, but we're really still in kind of the development phase of that. I will say that where I showed that we have the term administratively attached, undefined, and where we have the term administratively attached with department duties defined, the department duties defined is a little bit more defined. It's just more defined. And so, there could be the possibility of amending the Regulation Licensing Authorizing Act. And, we've begun exploring that as a possibility. And there could be the amending of individual practice acts. The problem with amending something like the Regulation Licensing Authorizing Act or even the Uniform Licensing Act is that there would then still be conflicting language in each practice act that would have to be addressed. And so it really lends itself, and I shared this with the Criminal Justice Reform Committee a week ago, and that is that this probably looks more like one of the bills that Senator Ivy Soto and I are famous for, which is a 400 to 600 page bill, to make that kind of change. And those can be problematic, as unless there's, like this combined effort to make something. I do know that when Katrina hit, that we did some emergency, the legislature did some emergency changes to statute to allow for some easier reciprocity, because folks in New Orleans and other parts of Louisiana literally lost their records. Their records were destroyed, and they had no record left other than maybe the license that they carried in their pocket, or in some cases they had nothing. And so there was some legislation that was, in response to Katrina. I trust, Madam Vice Chair, that there's probably going to be some legislation in response to COVID. What that is, I'm not really clear on that at this point.
Well, and it's interesting that you bring up Katrina, because I'm guessing we could be seeing exactly the same stuff, not from COVID, but from the West Coast.
Yes.
All the fires, the enormity of stuff that's lost, and people who may want to move away and get out of there, people who've lost their homes more than once. So is that still in effect, or was that specific to that time?
Mr. Chair, Madam Vice Chair, those things are still in effect. And we kind of looked at the reciprocity, the expedited reciprocity. I didn't point out individual statutes and how that might look or what it does look. Those things have not been removed, but the problems and the barriers that we're seeing now are, it seems to me, based upon the research that we've done, much more related to the higher levels of experience and education that are required in New Mexico versus other states, and looking at whether or not those are really, really tied to public health and safety.
Mm-hmm.
So I think it's a broader issue. I think there's a couple of issues that need to be addressed, and one is that emergency authority, and where does that get added in so that you can take, have one entity that's responsible for addressing things like the CLE has come up so many times in so many different ways as to whether or not it has to be in person or not. And then, testing has been a big issue for some professions because testing centers have been shut. They haven't been providing the testing. It seems as though some of that is opening up. And so how do we really quickly respond to those things without the administrative, as some would say, bureaucracy that puts up those barriers?
Thank you. I appreciate that. And it's without a doubt that COVID has highlighted where issues are, but those issues were pre-existing and have been issues in some of the licensing boards for years and a subject of complaint or attempts to change. So I really appreciate that your focus is on public health and safety. And I think additionally, it should be on access to professionals, because we're short, particularly today we're talking about healthcare. We are short in every health profession. And I think that historically, many of these licensure structures and the rules and regs around them have served more to protect the turf of professionals than it has to work to expand access while protecting the health and safety of New Mexicans. So it's a balancing act. I'm not suggesting wide open everything, get everyone here, but it doesn't have to be a barrier to legitimately qualified and trained professionals, and we should be easy on that. But it's far more complicated and messy than I had realized. So thank you for that. I do have a couple of questions. I did want to make a point about the art therapist. I'm pretty sure the chair can correct me if I'm wrong, or others. I think it's a pretty new licensure.
Mm-hmm.
So and we have several like this who are new to be licensed and in their profession, and it's kind of the first step to being able to advocate for being paid for that service, because it's hard to mandate payment for a service that is unlicensed if it should be. So it's kind of a first step, but and unfortunately, in the worst of times economically here, to mandate payment for it means Medicaid, which covers a lot of the behavioral health and a lot of our folks would require that we fund it for the state share, and I think change our Medicaid state plan, and potentially could even be a barrier at the federal level. So there are some things that the federal level, particularly under Medicare, won't let you do in a certain license just because we license it here when many other states don't. And so it's precluded. No comment on art therapy. I'm just saying in general, it could be much more complicated, but it is a brand new licensure type in New Mexico. So even contemplating mandating, and then the other hiccup in mandating coverage by health insurance. We still can't mandate self-insured plans, but even the ones that we can regulate and could potentially mandate coverage. And I'm not saying we shouldn't, but there is a hiccup in the Affordable Care Act that if it's not in a baseline approved plan, so it's a new benefit, then you can't use federal dollars to help pay for it. So I think there's ways around that and ways because behavioral health is covered, and so it's just a different, and other entities are providing that. They're just not licensed as an art therapist. So I think an argument can be made, but that'll be the pushback. So it gets complicated to try and mandate coverage. So we should talk about that some more, Senator, and explore that. But art therapists aren't the only ones. And then, let's see, is the nursing in healthcare, is the nursing compact our only compact?
Mr. Chairman, Madam Vice Chair, I don't have an affirmative answer for you, but it's my understanding that is correct.
Okay. I'm under and I don't remember where I saw it. I thought there was a number of compacts we had, but they may not have been healthcare related. They may have been other licensure related when I saw that, but I didn't think nursing was the only one, but I can't think of any other healthcare profession that we do have compacts. So we should keep looking at that. But PT, speech and audiology, psychologists are all looking at compacts. You had a slide on sunset, and I wasn't sure if I caught what you said, and I wasn't clear from the slide. Are these the only ones with sunsets, or these are the ones that currently we need to work on extending because they have sunsets coming up?
Mr. Chairman, Madam Chair, these are the ones that currently have a sunset that's coming up in this next legislative session. And so we're working on them. But years ago, they used to all come at the same time. And the legislature was kind enough to have them
stagger them
because it's a tremendous amount of work.
And
when we go and present to the LFC, it's a tremendous amount of preparation.
And are you able to, I assume we're able to do it in like an omnibus as opposed to each and every act being a separate bill, or does each one need a separate bill?
Madam Chair, Vice Chair, Mr. Chairman, yes. Right now, it's done as an omnibus. That's how it's always been done in the past. The former representative from Los Alamos used to be the one who carried it. And I'm not sure who's carrying those now, but they tend to be in that omnibus bill unless there's some specific amendments to the statute that might be necessary. Then it would be a separate bill. And I would just suggest that, there are some of these professions on this list. The nursing board does not have a sunset anymore. I believe the medical board does not have a sunset anymore. There might be some some boards that the legislature might look at and say, no, because this is a profession that we need to have licensed. That's always a possibility, because the Sunset Act only requires that boards that we need to kind of think about on a regular basis to see whether or not they're still necessary. And I would argue that the osteopathic board is probably going to be long-term necessary, similar to the medical board and the nursing board.
Right. Thank you, Mr. Chair. Thank you, Linda. That's helpful, because I know I've seen both, so that helps. And I was just trying to gear up for psychologically gear up for all those bills. So I know it's a time that individual boards like to relook at some things and update their act, but it does make it a little harder. I would assume, though, in that context, I'm just trying to think about the work we're going to have, Mr. Chair and Linda, that a specific act could be in the omnibus bill for the sunset purpose and still run a separate bill that isn't going to create a conflict with the sunset, because it would take care of that and try and update as well, so that if it didn't pass, it'd still be in the omnibus for the sunset. Correct?
Mr. Chair, Madam Vice Chair, Mr. Chair, that is correct.
Okay. Okay. And then one appointments. How is, and I know it was Mr. Chair and Linda, and this predates your time there, of course. But early in the administration, boards and commissions wasn't the highest priority, because it had to get secretaries and administrative positions filled and make the way through the statutorily ones first. But how are appointments? Is it caught up? Are all the boards up to date with newly appointed or whatever's needed, or do we still have many appointments to get made?
Mr. Chairman, Madam Vice Chair, members of the committee, we're actually working on that, and we're closer than we were 6 months ago, but there are still some appointments that need to be made. There are well over 400 boards and commissions in New Mexico, most of which are appointed by the governor's office, and it is a full-time job to do that. And so we've been working to identify the positions that need to be filled and then sending that information on. In many cases, the appointment has to come from an association list, a list that's provided by the association. So, for example, I just reported on the pharmacy board. They have 3 positions, 2 of which are currently filled, but their term is expired. So by law, they will continue to serve until they're reappointed or until a new appointment is made. One of them is vacant, but 3 of those positions have to come from a list that's provided by the Pharmacy Association. And that's the case in some of the more professional types of boards. So long answer, we're getting closer, but we're not there yet.
Mr. Chairman, Madam Vice Chair, this is John Blair. If I could add briefly, I can tell you that I'm working right now with the chairs of the Podiatry Board and the Social Work Board, both of which are interested in getting some additional members placed right now. So those are 2 examples of what we're trying to do. And as a point of personal privilege, Madam Vice Chair, I hope you will give my very best to Aaron. So thank you.
Oh, thank you. Thank you. I appreciate that, John, very much. And I'll make a plea on behalf of the future executives. Please, please, please track these board appointments and expiration dates. I know that the governor came into this without having any information at all about who was, and it was really, really hard to figure out each one of those 400 boards, what positions needed to be filled and when positions expired. So I know it was a huge job, but I hope you are developing a good system for tracking that, because it doesn't serve the state very well. While many of them are political appointments and maybe want to be protected by the executive as to who they are, because they'd like to keep them in there and not notice that they're, that they were. It does not serve the public well when all those boards and commissions have, particularly when they've got regulatory authority and you don't have a functioning board. So thank you for continuing to work on that. And it'll be an ongoing issue because everybody's terms expire. So it's not just filling initial appointments, but it's an ongoing issue. So thank you. And then I think that is, are you, Mr. Chair and Linda, planning on, I know it's overwhelmed and you probably don't want to introduce 20 pieces of legislation out of your thing, but is there thoughts and talk about cleaning up the unclear administrative duties in some of those acts where it's not delineated, the administratively attached ones that are just totally up in the air as to what your role is? Is there thought about cleaning those up?
Mr. Chair, Madam Vice Chair, there is discussion about that as a possibility. There's also some discussion about the possibility of some consolidation, maybe changing some to advisory, those that are a little maybe smaller, that only meet once a year or twice a year. There are some boards that haven't updated their rules since 2006 and 2012. That's a long time. And so we are looking and exploring. We're trying to prioritize what's going to be the most important thing to move forward, again, for that public health and safety issue, to make sure that we're addressing those things that need to be addressed first of all, because it would be challenging to submit 30 to 50 bills that are hundreds of pages.
Right. Right. Thank you. Thank you for that. Mr. Chair, I just want to thank you for all you're doing. And I want to, for any that are listening, I want to thank the professions and the public who serve on those boards. I have served on licensing boards in the past, and it is a lot of responsibility and a lot of work. And as we've all seen, it is critical that they work efficiently and are so we can get the staffing and the professionals into the state that we need, and to get those who have just graduated licensed and so forth. If we want to have a functioning healthcare system, we have to have not just a pipeline and those who are interested. We gotta get them licensed and practicing. And so this is a critical piece of the puzzle, and it is a lot of responsibility and work. So again, I really want to thank particularly the public members who step up to serve on these boards, and the the professionals who are interested in maintaining the professional integrity of their profession. And I do think it's important, very important, for those professions to be weighing in on how their profession operates and what some of those rules are. I think that's critical, that you have the expertise of those who are trained, who are weighing in on what to be expected. So I'm not ever going to suggest that we move away from authority of those professions on the boards, but we do need to make them work efficiently and focus on health, safety, and access to the greatest extent possible. So thank you, Mr. Chair. That's all I have. Thank you.
Thank you, Representative Armstrong. And if you have a question, Representative Miguel Garcia, this would be the opportunity to ask it now.
Mr. Chair, can you hear me?
Yes. Yes, we can.
Oh, great. Great. Thank you, Mr. Chair. Thank you, Linda. these questions really were for the prior presenters of the NCSL. Unfortunately, I wasn't able to kind of get a connection. I wasn't able to unmute. Linda, so I'll kind of tailor the question to our state. And the question that I was going to ask the NCSL on a national level, but I'll ask it to you at a state level, is of the healthcare professionals licensed during the COVID-19 period, do you know what percent of those went into urban areas versus rural areas?
Mr. Chair, Madam Vice Chair Representative, you will always be my Mr. Chairman. It's lovely to hear your voice. And I don't know how many were licensed. I think what you're asking is how many individuals are licensed in rural communities versus urban communities. And I don't know.
Healthcare professionals, Mr. Chair.
Yeah, healthcare professionals.
Just healthcare.
John, I think we can get that information from you by running a report. Are you interested in knowing the newly licensed or the current license based upon address?
Yes. We're talking about newly licensed healthcare professionals. I don't know if there is, Mr. Chair, also a renewal licensing. I know that with some professions you have the continuing ed, but I'm mainly interested in the new licensees in the healthcare professions. And you know, Mr. Chair, that this is kind of an important issue. You know, I've been trying for the longest time to do that rural healthcare practitioner tax credit to include 3 new professions: the behavioral health therapists and counselors, the social workers, and the pharmacists, mainly because of the need for these healthcare practitioners to settle practice in the rural areas, of which we don't have a lot of these professionals going into the rural areas. So I'd appreciate it, Mr. Chair, if there is a way to find out, especially during this kind of real chaotic situation that we encounter with COVID-19, and see exactly where our healthcare practitioners are landing, especially during these hard and difficult times. The other question I had has to do with a similar train of thought regarding the licensing of healthcare practitioners. I don't know if we do it or not, Mr. Chair. I know that we've tried and we were successful in many initiatives, healthcare initiatives, to include goals and targets that certain individuals training for an MD, training for a dental assistant, et cetera, that these students kind of reflect the face in New Mexico, that the students that we recruit reflect the face in New Mexico, which is 48% Hispanic, 10% Native American, 65% rural. And in our licensing, I wonder if we have, Mr. Chair, those goals and targets. We're not setting quotas here. We're basically setting goals and targets. And if in certain positions, professions, individuals that are getting licensed in certain healthcare professions, if there is kind of a skewed chart that shows that maybe we need to work on recruiting more individuals into these professions, I think it would behoove the state to establish those goals and those targets and give our licensing boards something to chew on if these professions that we're licensing really don't reflect the face of New Mexico. And so, Linda, to your knowledge, Mr. Chair, what do we have in place, if any, regarding these licensing boards kind of reflecting a target, a goal of the individuals that they're licensing, kind of reflect that face of New Mexico?
Mr. Chairman, Madam Vice Chair, Representative, the goals for our particular boards and commissions is in relation to how responsive we are to licensees, applicants for licensees, and how quickly we resolve disciplinary actions. But the goal of this administration is to not work in silos. And so John and I and Superintendent have begun the process of reaching out to, as John mentioned, Director Blair mentioned, to higher education. We've begun meeting with Health and Human Services. We're looking to collaborate on ways that we can all work together to not just, reduce barriers, but as Madam Vice Chair indicated, to increase access. And in order to increase access, we've got to look at how the licensing boards can help reduce barriers, and how places like agencies like higher ed and Department of Health and such can increase access through educational dollars, through the ability to do training online, to access to. One of the things that we're looking at, and we had on the screen earlier, is that we're also very interested in collaborating with correction industries, with the corrections department, to identify professions that incarcerated individuals can be trained in and then can qualify for when they are released. And so we're really trying very hard to not function in a silo. And we believe that in doing that we will begin to create access to training and licensure so that those professions do in fact reflect the diversity of New Mexico.
Thank you for that, Linda. Thank you, Mr. Chair. That's all I had.
Very good. Is there anyone else with any questions for the presenters? It's uncannily close to our lunch break time, 1 minute. Did you have any final closing comments, Linda? And it's great to see you, incidentally, but any closing comments from either you or John?
Mr. Chair, Madam Vice Chair, members of the committee, just thank you for inviting us, giving us the opportunity. I know it's within 1 minute, we've probably hit that 1 minute, but I could do this for hours. It really is one of the things that I truly love. I feel like I'm back at home, and that I'm being given a real great opportunity to help improve professional licensing in New Mexico. So giving us the time that you've given us and your ear towards helping us move towards that goal is incredibly important to me. And I just am honored to be able to present that information and want everyone on the committee to know that if you have any questions, if you have any issues that come up with constituents, that John and I are available on a regular basis. I talked about construction industries opening up. Part of the reason for that was because construction is actually an economic driver in New Mexico right now. And it was important that we work with the governor's office to ensure that that's not delayed in any way. But your time is important to us, and I just want to say thank you from the bottom of my heart.
Well, thank you both very much for your input today, but also for the energy that you're bringing to this task. You've got a big job ahead of you, but we know you're going to do a great one. So thank you so much. And members of the committee, we'll take our lunch break now. We'll return at 1:30, and we have public comment, and then some information about the physical therapist compact and the situation with nursing in the state. So we'll see you after lunch, and see you soon.